Hi students, can you hear me? If you can hear me, please acknowledge by saying hello. Okay, good. It's great to have you back in class this evening. What we're going to do tonight is we are going to first just review some of the things we talked about last week, and I am recording the lecture. Excuse me. And then we're going to go to I got strangled. I aspirated. I'm so sorry. Then we're going to go to Chapter 5 and talk about the nerve cell physiology. Hopefully you've gotten your books and you've had a chance to read. And so I always like to review first before I move on, but we will finish Lesson 1, Scope, Principles, and Elements of Neuroscience, and then we will go on to nerve cell physiology. And we are going to watch YouTube videos tonight. So what I'll do is pull up the YouTube video, but you'll also see the YouTube address in the event that you cannot see the video or that your computer goes slower than mine or faster than mine or whatever. Okay? That being said, because I am at home and I'm teaching from home tonight, I want to make sure that I can hear you. So as I call your name, please say hello to me, okay? So Adriana?
Here.
Okay, good. Allie Austin? So, Allie, I couldn't hear you. Try again.
I'm here.
Okay, good. Thank you. Allie Harrelson? I think, Alyssa, you said you wanted to be called Allie, correct?
Yes, that's right. I'm here.
Okay, good. Amanda?
Here.
Good. Angela?
Hi, I'm here.
Okay. Audrey?
I'm here.
Good. Brittany?
Here.
Chelsea?
I'm here. It's actually Chesley.
Okay, say it again.
Chesley.
Oh,
Instead of
Chelsea.
Chelsea.
Okay, thank you, Chesley. Is that correct?
Yes, ma'am.
All right, good. Well, thank you so much. Sierra?
Here.
Hannah?
I'm here.
Okay, Jacqueline? Jackie Paris?
Here.
Okay, do you want to be called Jackie?
That's fine.
No, what would you prefer?
I go by Nikki, but I answer to anything nice.
Oh, Nikki. Okay, I got to remember that. Okay, I'm going to have to write that down, Nikki. But don't worry, I got you. I'll get it.
Thank you, ma'am.
You're welcome. Okay, Jackie Wagner?
Here.
All right, is Jackie okay for you?
Yes, ma'am.
All right, good. Jenna?
Hello.
Okay, Joshua?
Here.
All right, Julie?
Good evening.
Okay, Kendra?
Hi, I'm here.
Okay, good. Kiana?
Here.
All right, Lakin?
Here.
Good. Lillian?
Hello.
All right, Lindsay?
Hello.
Michelle?
I'm here.
Natalie?
I'm here.
Nicole?
Hi.
All right, Rachel?
I'm here.
Rola?
Here.
All right, Shelton?
Here.
Whitney?
Here.
Okay. And Chesley, thank you so much. I actually didn't see the L in your name until you said that. So now that we are all here, am I missing anyone that you guys are aware of? I don't have my class roll. I'm just at home today. I actually had a issue I had to help my husband with. Can you believe he went to South Carolina, rode with a group of people, didn't come back with the group, but left his car keys, his house keys, everything in South Carolina, came back with my son, and got back home and said, uh-oh, I can't get my car. So we had to have it towed, and we have to get a new fob made and so forth. So that's why I'm at home. But normally I will be teaching you from my office. Yes, he just, I don't know what he was thinking. But at any rate, I'm a very positive person, so there's always a solution to a problem, and we solve the problem. But this is the first time I'm teaching from home. So you guys are hearing me fine? Is my mic, everything is fine, the volume, everything? Because, you know, I get leery. Oh, okay, great, good. Thank you so much. So in our class last week, the purpose was for us to really understand some basic concepts about what neuroscience is and why we care about neuroscience. And we talked about the fact that there is a relationship between neuroscience and speech-language pathology. And can anybody tell me what that relationship is? And if you want to talk, raise your hand. Why do we care as speech-language pathologists? Why is it important for us to understand the anatomy and physiology of the brain? Okay, good. So Kendra says we need to know how the brain works so we can know how speech works. Okay, that's good. Who just raised their hand? I don't see your hand. Oh, Whitney. Okay, Whitney, talk to me.
Much of language happens in the brain, and so since we deal with language, it's within our scope of practice to know some of the brain.
Exactly. And it's not just expressive language that we're concerned with, is it, guys? Because receptive language also occurs in the brain. But what other things are we concerned with that if the brain isn't working properly, we're going to have problems with? So we know speech and we know language, but what else? Okay, Rachel?
It also has to do with respiration and articulation. Our brain connects to those muscles and nerves that innervate the muscles. So those have to be working as well for us to speak. And the auditory system is connected to the brain also.
Okay, excellent. So that's the speech component, the articulation, the voice, all of those things are important to the brain. If the brain doesn't work properly, we're going to have problems communicating. But guess what? We're also going to have problems thinking, depending on where the problem is in the brain. So cognitive functions are very important. Higher order mental functions. Michelle, go ahead.
I think also being able to work with other professions in the field, to be able to consult with them so that we have that kind of knowledge to be able to work alongside them and come together with a plan to put place in action.
Absolutely. I want to say that our students participated in 2 simulations with medical doctors, pharmacists, social workers, who else? OTs, PTs, this past semester. It was wonderful. But guess what? The other professionals didn't know what we did. They had no idea that we were people who could work with those persons who have cognitive and language problems, cognitive linguistic problems. Absolutely would not have called us. They would have called the neuropsychologists. They only see us as having something to do with swallowing. And so one of the clinical cases, the swallowing was fine. And the team kept saying, well, what do you guys think about swallowing? And our students will say, well, the swallowing is fine, but we need to deal with the cognitive issues that's occurring. And they were just blown away. So you're right. We need to know what other professionals do, but they need to also understand that we as SLPs are intimately involved with the brain and problems that occur as a result of damage to the brain. So speech, language, cognition, swallowing, all of those things are important to us. So that being said, we talked about different branches of neuroscience. And the first branch we talked about was neurology. So what is neurology, guys? What is neurology? Anybody? And Jenna, your response is right on, too. So is yours, Nikki. Neurology, let's see. I can't see who raised that. I think Michelle, Jenna. Well, Jenna, we'll go with you. Or either Michelle. Michelle, I think you're number one. My screen is so small. Okay, go ahead. Michelle first, and then Jenna.
It's the study of the nervous system.
Okay.
Oh, sorry, Jenna, can I go?
Okay, yeah, that's fine, Jenna. It is. It's the study of the nervous system, which means...
And diseases that disrupt its normal structure.
Excellent. Very good. So it's not just the nervous system, but it's the structure, the anatomy, physiology, and its diseases. Okay, so then what is neuroanatomy? If I'm only looking at neuroanatomy, somebody, what is neuroanatomy? So break the word apart. Neuro means the brain, okay. Adriana?
It's the structural elements of the nervous system.
Excellent. It is structure. Okay. Then that brings us into neurophysiology. What is that? Okay, so, and raise your hand if you need a turn, okay? Rachel, we'll go with you, but Joshua and Natalie already said function. So Rachel, what were you going to say? You can type it or you can raise your hand. I was going to say function. Good. So anatomy.
I was going to say.
Go ahead. Are you talking?
Oh, yes. Neuroanatomy is the function of those nervous structures.
Okay, so neurophysiology is the function of the nervous structures. Okay, and neuroanatomy is the structures themselves of the brain. Okay, what about pathology, neuropathology? What is that? Okay, Kendra?
That's the diseases. Rachel already put it down there. That's the diseases of the nervous
Okay,
system.
excellent. And so we know neurosurgery has to be surgical removal of any kind of tumor or some type of repair of the brain. Neuroradiology is imaging of the brain. And embryology, neuroembryology, is the study of the development and the origin of the development of the brain. So everybody has those terminologies. So that's good because on your first quiz, you'll see that again. So make sure you can identify that. And then we talked about the fact that there were different types of diseases that can occur as it relates to neuropathology. And some of those diseases would be things like a cerebral vascular accident. And can anybody tell me what a CVA is, or a cerebral vascular accident? What is that? Okay, Lakin.
Stroke.
That's exactly what it is. It's a stroke. So generally when somebody strokes, it's a problem with the blood supply. There's some type of blockage that occurs in the artery. It could be due to a buildup of plaque, or it could also be a CVA as a result of hemorrhage. So we have two types of CVAs that we can have. One could be ischemic, and ischemic means that it is a blockage. And the blockage can either be a thrombosis, and a thrombosis is a stable blockage. In other words, the blockage occurs at one site and there's no movement. Or it could be an embolism. An embolism occurs when there is a clot that moves from one part of the body to another part. So let's say you could have a clot in the area of the heart, and it breaks off and it just travels to the brain and you stroke out. Or you could have a hemorrhage, and a hemorrhage refers to a blood vessel that bursts. Just like you blow up a balloon and you can continue to put air in the balloon until the balloon pops. So there's a lot of pressure that is being placed among the arterial wall, and it causes that artery to balloon out and eventually to rupture, and so we have a hemorrhage. And so that's a hemorrhagic stroke. So you can have an ischemic stroke, which means there's some type of blockage, or you can have a hemorrhagic stroke, which means that there's some type of bleeding in the brain. We can also have other problems in the brain that occur, like a traumatic brain injury. And when we talk about TBIs, we can have a mild concussion or a moderate or severe concussion. But what do you think are the most common causes of traumatic brain injury? Anybody? Okay, falls, accidents, sports collision, car wrecks. Yes, excellent. And those are very common, and we find that a lot of young kids teenagers and people in their 20s probably have car accidents. But who do you think is falling? Who's falling? Elderly, yes. But only the elderly guys? What about your toddlers? That's exactly right, kids. So when your kids fall and they hit their head and you say, uh-oh, that was just a boo-boo, you really need, if it's a hard fall, you really need to watch them because they could have a traumatic brain injury. But something that you guys have not mentioned in terms of TBI is that we are in a war. And our soldiers are coming back with blast wounds. And this is a whole different type of problem that we're seeing because the blood vessels, they're really beginning to, it's hard to study this because when you have a blast wound, it could be a penetrating wound, maybe they stepped on an IED, or so what might happen is that you might have some hemorrhaging there, but it not only affects the brain, it affects the heart, the lungs, the ears. So, yeah, these are all types of things that you guys are going to be faced with, particularly, with us being in the conflicts that we're in, Afghanistan, Iraq, so forth and so on. Shaken baby syndrome is definitely a type of TBI. Okay, so all of those things fall under the category of the branch of science called neuropathology. And we also have degenerative diseases that we're very familiar with. Everybody has heard of Alzheimer's disease, and what we have is a change in the cellular structure so that the person has neurotangulary fibers and plaque and a problem with tau protein, but that's a problem with the neuron. And so we're going to talk about a lot of different types of disorders as you learn the anatomy of the brain. Okay? Now, we did talk about the fact that there are principles that govern the human brain. And one of those principles was the centrality of the central nervous system. Who can talk to me a little bit about what that means? What do we mean? Okay, Kendra?
That means that all the sensations and everything from like the peripheral nervous system has to go through the central nervous system to be comprehended.
That's exactly right. Everything has to come in from the peripheral nervous system. Anything that comes into your body, any sensation, it comes in through the peripheral nervous system, but it must go through the spinal cord to the brain to be interpreted and understood. Okay? And anything from the brain, any kind of motor movement must go through the central nervous system to tell the peripheral nervous system what needs to happen in order for a muscle or a gland or something to work. So, okay, any questions about that principle? Okay, so let's see, what was another principle? We talked about the bilateral anatomical symmetry of the brain. And what does that mean? Because that falls under the principle of the laterality of brain organization. So what do we mean by that? Just think about it. Bilateral anatomic symmetry. Okay. All right. Okay. All right. Nikki? Nikki, I think you raised your hand first.
That both sides of the brain are equal, pretty much equal in their jobs.
Yeah, I mean, they have equal potential, but they mirror each other in what they look like in terms of structure. Okay, but the right side and the left side might be different in their functions, but in their structures, they do kind of mirror each other. So they're considered to be essentially identical to each other. And that makes sense, doesn't it, guys? Because what if, just what if, I had a brain injury, let's say in the right hemisphere? A surgeon should be able to find my primary motor cortex on the right side, just like he would be able to find it on the left side. Okay, and since we're talking about that principle, what about the culturally neural brain? What do we mean by that? What do we mean by that? It's neutral. It's neutral. The brain is neutral. Okay. Let's see. I don't see who raised their hand for that. But let me see. It doesn't matter where you come from. Brains are the same. Absolutely. Brains are the same no matter the culture, color, etc. That's exactly right. Now, basically, exposure determines the amount of knowledge I have. But the brain is the same in everybody. And so if I'm not exposed to a particular concept, then I may not know that concept. Or I may think about things a little bit differently than you based on the culture from which I have been influenced. Okay? And exposure. If I've never traveled further than Franklin, Tennessee, all I know is Franklin, Tennessee. I may not know what occurs outside of the boundaries of the place in which I live. But in general, all brains have the potential to learn. All people have the potential to expand their knowledge and to grow their neural connections, let me put it that way. It's just a matter of what your exposure is. But gender, color, and so forth has nothing to do with the way the structure of the brain is. Okay, so it just depends on how well you can process information, attend to tasks, plan, do all those things. Okay, we also talked about, let's see, what was another concept? Plasticity in the brain. What about that? What does that mean? Okay, Sierra?
In trying to cope with any kind of damage, the brain will reorganize itself to compensate.
Exactly. In other words, the brain really does try to function even through damage, even if there's damage. So plasticity occurs when other areas of the brain try to take over the function of the area that's damaged. Now, plasticity decreases as we get older. It's better to learn Like, let's say I'm just going to use, like, if I wanted to learn 5 or 6 languages and learn them naturally, it's better probably for me to come up learning them as a child. Because the older I get, it's not that I can't learn 5 or 6 different languages, right? But it's just that I'm definitely going to need instruction to learn those languages. In other words, you need to teach me the rules. But if I'm coming up as a kid, and let's say I'm in a household where my mother talks speaks French, my father speaks Spanish, and another language is being spoken, then I can actually learn those languages. I may mix and borrow, but as long as I'm exposed to those languages, I will learn them naturally. As I get older, if I've never had any instruction in those languages, you're going to have to teach them to me. And then I probably am not going to be as fluent as I could be if I grew up speaking those languages. So plasticity, the brain does try to take over function. Different areas of the brain try to take over functions that are damaged by in a particular area of the brain. Now, it doesn't say that you're going to be like 100% successful. Depends on the extent of damage and all those kinds of things. But it is good to know that plasticity is something that is a principle that we have observed to be important to brain function. Okay? All right, so let's see. So you got some of the, make sure you learn the principles of the brain, because I could ask you about any one of the principles at any point in time. Now let's talk about terminology as it relates to directional brain orientation. Okay, so what does dorsal mean? What does dorsal refer to? Oh, wait a minute, somebody had a question. Wait a minute. If Wernicke's area is damaged, will another area of the brain take over language comprehension, or do we work to retrain that area? You know, that's a good question, and so it depends on your philosophy. Retraining, you might try to retrain that area, but doesn't mean that you're going to be totally successful in retraining that area. So the goal might be to take the areas, to take your strengths and make them stronger. Okay, so for example, someone who has Wernicke's aphasia may not understand as a result of the fact that it's the area that's damaged is the posterior superior temporal lobe in the left hemisphere. And so it depends on the extent of damage, but just because they don't understand most of the time doesn't mean that they don't understand some of the time. And we could actually take their strengths. So like maybe they can read. And so we could actually take the word that they can read and pair it with a picture to teach them to comprehend again. So it just depends. I might not be able to 100%, solve the problem, but if I work with your strengths, I may be able to help you learn how to compensate. So that's a good question, and it just depends on the extent of damage. And the other thing I want to say to you is that most people who have some kind of damage that causes some type of aphasic type of behavior, like with speaking or understanding or reading or writing, with training, they can actually evolve from one type of aphasia to another type of aphasia. So, yeah, it just depends on whether we want to preserve what that person already has or take his strengths and, make them stronger to help get rid of the weakness. But to totally, solve the problem may or may not occur depending on the damage. I hope that makes sense. Okay, so dorsal means towards the back. What do I mean when I say ventral? Okay, ventral means towards the front. And but dorsal could also be the top of a brain, or ventral could be the bottom of a brain. Okay. We talked about coronal. What does coronal mean? Okay, so left, right. No, not left, right. Left, right is sagittal. But that was a good try. Front, back. So coronal means dividing the body into the front and the back. Good. All right, very good. No, that's okay, Angela. There are no mistakes in this class. Even if it's a mistake, it's no mistake because we're just learning. That's all this is. Okay. Sagittal means to divide, to divide in terms of the left side versus the right side, but coronal means front and back. What does horizontal mean? How would you divide the body if I said do a horizontal cut? Okay, so sagittal means in the middle, Natalie, but top and bottom is horizontal. Okay, very good. And then if it's going to be transverse, what am I talking about? Yeah, angled or it's a diagonal to the cross plane of the brainstem. So that's what you got to remember. Remember those terms, okay? If somebody is, if I'm talking about extension, what am I talking about? Oh, that's a great analogy that you just made, Julie. Okay, good. So extend means to straighten, flex means to, so flexion means to do what? To bend. Excellent. Okay. And if I'm talking about pronation, which way would my hand go? Okay, good. Pronation, my hand would go down, but supination, my palm would go up. Okay, good. All right, so I believe that we have reviewed, and we're going to go on to new terminology. And so now I'm going to move the slides. Okay, let's see. I think, so we talked about that. That's just an example of dorsal. Superior is the same as dorsal when we're talking about the brain. Rostral means anterior. Caudal means posterior. Good. External, internal. Anybody have any problems with any of the terms that we talked about? Just to review, medial means toward the midline, lateral means away from the midline. Proximal means towards the body. Distal means away from the body or the roots. So distal, the most distal body parts that you have would be your fingers and your toes. Okay. All right, let me see. Yes, I review like this at the beginning of every class. And to be honest with you, if I hadn't been dealing with my husband and his car situation, losing his keys, I would have tried. I want to do Cahoots with you guys. And I'm trying to see if so the next time we come, I'm going to try to do like Cahoots is so much fun. I think one person in the class indicated that they like Cahoots. So if I could see whether Cahoots, I can put it in to Blackboard Collaborate. If it is a PowerPoint format, I'm not sure. Then we'll try to play Cahoots because that would be so much fun. Okay, but yeah, I think we have to review before we go on because I want to make sure that you do well in the course and I want to make sure that you understand. Okay, so let's see. So that's an example of, okay, we talked about abduction, adduction, and you talked about this. I think that you have to, do you have to download Cahoots? I think I give you the web address. That's what happens. I think I can actually do. I'm so glad you asked that question. You know, guys, I'm silly, so y'all have to bear with me. When I get excited about something, I talk to myself. But I think that what happens is I can show Kahoots through the website, through using, going on the website, because I can go on the website and show it here in Blackboard Collaborate. So what happens is I'll give you a web address, and then you'll go to the web address, and then when we get ready to play, everybody signs in. You get this kind of password, and you sign in. And when you get ready to play, I'll ask a question that you'll see typed, and you'll have multiple choice responses. And you'll have like maybe 20 seconds to respond. And once you answer, it shows how everybody in the class answers. And it's sort of like Jeopardy. It shows who's in the lead. And so you're really competing against each other. So it should be fun. Let's try it next class. And I will be in Colorado, teaching you from Colorado next week. Not that that matters because it's a distance course. But the point is I'll be traveling. So what I'll try to do is make the Kahoots game while I travel. And we'll see if we can play Kahoots next week. Okay, and the book is difficult to read, but read it anyway and try to do your questions at the end. Okay? And I'll try to make the content as simple as possible. Okay, so let's see. Abduction, adduction, pronation, supination. Okay. We talked about the different types of terms related to muscles. Skeletal muscles are under volitional control, and I want you to think about the fact that you move your arms, your hand, your feet, your legs. You use your skeletal muscles to do that, and that's why it is volitional. No, they're multiple choice, Rachel. One thing I want to tell you about your book, I know you haven't had a chance to go through it, but the answers to the chapter questions are at the end of the book. So that's the good thing about your book. But what I want you to do is to try to answer the questions yourself and then go back and check yourself, okay? I bet you guys didn't know that, did you? Okay, Brittany, well, all you got to do is go in the back of the book, and all of your answers are there. Now, that means don't cheat. Don't do it yourself first. And if you can't get it, then look for the answer in the chapter. And if not, double check yourself. Look at the back of the book. Okay, yeah, it's difficult, but Angela, it's new materials too. And so you're learning new terminology, and so, oh, Brittany, you found them. Good. Okay. All right. That was helpful because some of my answers I wasn't sure if they were correct. Yeah, so you can always check yourself. And guys, it is a lot of new terminology, and we're taking this course in the summer. So it's a 4-hour course, but you gotta, the only way you're gonna get this is that I would ask you if you could just take like 5 or 10 minutes a day, 5 minutes a day, and just review the lecture or just review the PowerPoints. And you gotta look at these structures, and remember, I put resources in your course content for you to use. Use the resources, particularly when you go into that lab where you can put a arrow on a name and then it shows you the structure. You're only going to learn it by constantly seeing it. And that's how I became so good in neuroanatomy. To be honest with you, I will meet you guys in July, obviously, but my screensaver it's just nothing but pictures of the brain, disease of the brain. And so I watch it so much now that it just becomes second nature. So, I mean, it'll become second nature to you only if you put in the time to learn it. Okay? Oh, okay. So volitional, Michelle, means that it means it's voluntary. It's under your control. So with the skeletal muscles, you can choose to flex your muscles if you want to. It's up to you. If you want to kick your leg out, you can do that. So that means volitional just means voluntary. Okay. But what about your cardiac muscles? They are not under your control. Okay, your heart beats regularly at a certain rhythm, number of beats per minute or whatever, second or whatever. But guess what? If you become afraid, what happens to your heart rate? And you're right, it's part of the autonomic. It speeds up. Now, can you control that? No. Now, you can tell yourself, I'm not scared, I'm not scared. It's going to be all right. I'm telling you, I have a fear of heights, and I still can't control that fear. But only because my dad had a dream and he saw me falling. And so that's how I think I'm going to die or something. So I stay away from, really high places. In fact, you guys should have seen me. Anybody ever been to Chimney Rock? Okay, I got one person. I got 2, 3. Okay, so you guys know that you get up in an elevator and you go up to the top of the mountain. And you know that you walk across a swing bridge and you can hike down. Have you guys done that? Now, you can hike on the outside of the mountain, or you can hike on the inside of the mountain. But, of course, because I have fear of heights, when I went up in that elevator, I had no idea that I was going to be hiking down. This was my crazy husband. He had me up in the mountains and with my kids, and then here all of a sudden, I'm following them, and I realize I'm on the outside of the mountain, and boy, you talking about fear. I just could not move. And so I began to cry. And I remember my son saying, "What is wrong with her, Daddy?" Now, he was a little boy. And you know what? My reaction was to turn around and go back. But guess what happened, guys? I would turn around, and guess what? I couldn't go back because to go back meant to go up to get from where I started. So that was outrageous to me. And Chesley, you're absolutely right. You're absolutely right. Now, there are no mountains in South Carolina, Tennessee, and North Carolina. The mountains are, we just have hills here. But what, 14,000? Whatever in Colorado? My brother went to the Air Force Academy, and of course, I'm going out to the, he's a retired Delta pilot, but he went back to the Air Force Academy to be the CEO of the Associates of Graduates, and he's retiring again. So I'll be out there again next week. But let me tell you something, the elevation, there's no way in, I can only say there's no way in on heaven and earth would I ever consider hiking, because I am afraid of heights. But it is absolutely beautiful there. Okay, so think about the cardiac muscles. They do have striated fibers, but you can't control your heart rate. You just do everything you can to make sure that, you are healthy, so forth and so on. So your skeletal muscles are things that you have volitional control over. You decide how you're going to, when you're going to move them, what you're going to do with them. Cardiac, no volitional control. And your smooth muscles are involuntary as well. They're non-striated, but in terms of the fibers, but they're involuntary as well. Your smooth muscles, so this is an example of your skeletal muscles. And then there's your cardiac muscles there. And then your smooth muscles would be things like your digestive system. I have no control over my digestive system in terms of those non-striated muscles moving. When I want to go to the bathroom, my stomach just tells me I need to go. And if I get afraid, I might not be able to control my bowels or, my bladder or whatever. So those are the digestive system, the stomach muscles, so forth, the urinary system, all of those things are smooth muscles. Okay, so we talked about that. And then I think that we ended up here talking about the different types of plegias. So we have mono means one, and plegia refers to paralysis or either weakness. So weakness, or well, paresis really is weakness. Plegia is more paralysis. So paralysis of one upper limb is monoplegia. Hemiplegia is paralysis of one side, so that would of the body, so that would include the upper and the lower limbs on one side. Triplegia means you're going to have 3 limbs that are paralyzed, and quadriplegia, 4 limbs, and then para means to both of the lower limbs. Okay. So now, oh, I didn't mean that. I just wanted to show you. So there's a picture for you so that you have some understanding. Everything in the blue means that the body part is not working. It's not functioning. So everything we're talking about you will see on a quiz, so make sure that you learn again the terminology, okay? So now let's move on to something that's more related to the brain. In anatomy and physiology, did you talk about the brain somewhat? Just basically? Yes. Okay, great. All right, so then this might be familiar terminology. Some of it might be. Okay, so gyrus or convolution means that it's the crest of every fold. So it's like what I call the raise or the bump. Okay? If it is singular, we call it a gyrus. But if it is plural, we call it gyri. Okay, G-Y-R-I. Sulcus is a groove or an indentation. And if it's a fissure, it could be a sulcus or it could be a fissure, but if it's a fissure, it's a deep cut or a deep indentation. Like, for example, the right side of the brain can be divided from the left side of the brain. So the right hemisphere is divided from the left hemisphere by the longitudinal fissure. Okay? And that is a deep cut. So if I were to take my hands and to pull the brain apart, I could actually stick my hands down into that longitudinal fissure, pull it apart, and see the corpus callosum, which is a commissural fiber. We'll talk about that later. Okay. Opercula is a covering. And so it's where, well, I'll show it to you, but these are margins that come together to cover a particular area of the brain. So I could actually take, they're like folds, F-O-L-D-S. So like I could actually take my hands and pull or peel apart the folds. Think about, I don't know if this is a good example, but think about an orange. And if you were going to peel an orange, the orange has a little circular area at the top where I guess you can pick it from a tree, so maybe a stem was there. So think about that circular area and the skin all coming together to meet at the area where that circle is. And now you want to pull apart the skin of the orange or you want to peel it. So think about you taking your hands at the top of the orange and just pulling it apart, and so that you can get actually to the orange. Well, the fold, if I were to try to put the skin back to make it go back together at the area where the circle is, that would be what I would call my cover. I want to cover the orange, and then I want to uncover it by pulling it apart. So opercular means cover. Does that kind of make sense? And I'll show you that in a picture. But does that kind of make sense a little bit? Okay, so I'll show it to you, and then it'll kind of make more sense. Yeah, I'll show you a picture. How many people have their books? Where you take your finger to separate the peeling from the circle, that would be the opercular. Okay, if you have your books, turn to page 40. Turn to page 440. Hold on. Because I have to be able to show you I have to be able to identify it. I'm going to identify it for you when I show you the next page. But I need a picture that labels for you. Turn to chapter 2, Gross Anatomy. And look on page 41. Now, when you get to 41, look at figure 2.5. Okay. Now, at the bottom of the brain, we'll find the frontal lobe and look at the inferior part of the lower part of the frontal lobe. Tell me when you see the inferior frontal gyrus pars triangularis. Let me know when you see it. Okay, Whitney sees it. Everybody else sees it? Okay, now look directly below it and you see the inferior frontal gyrus pars orbitalis. Let me know when you see it. Okay, now right below pars orbitalis, identify the inferior frontal gyrus pars opercularis. Let me know when you see the opercularis. Okay, now, if I were to take my finger and to pull that pars opercularis away from pars orbitalis and pars triangularis, guess what I would see? Because it's a covering. It's a covering. So let me show you what I would see. Turn to page 51. And look at figure 213. Let me know when you see it. Okay, do you see that you are looking at the insula? You're looking at the insula because pars opercularis has been pulled apart from triangularis and orbitalis. 51. So an opercular is a covering. It serves as a covering. It's a the convolutions are the raises, and it serves as a covering. Does that make sense? Okay. So if you think of opercular, think of where the edge of a margin comes to meet up with other things. See, pars opercularis, pars triangularis, and pars orbitalis kind of come together. But if I want to, and so they actually, opercularis is actually covering the insula. So all I got to do, and I mean literally, because the brain is soft tissue, so all I got to do is take my fingers and just pull it back. Okay? Yes. Well, you know where it looks like that brain has been cut? Guess what area that is? That's Broca's area. That's where language is. Okay, remember we talked about Broca's area, and we said that the relationship between neuroscience and speech-language pathology is that there was damage to Broca's area, which is pars triangularis and orbitalis up in that area, that triangle that you're looking at there, and the guy couldn't talk. So that's how Broca made the relationship between, damage to this area in the inferior frontal gyrus results in inability to use your language. So the person could say one or two words or no words, okay? All right, everybody understand opercular now, meaning like it's a cover? Oh, that's cool. I'm so glad. Yeah. Okay, so let's move on. Commissural refers to a band of fibers connecting part of the brain or spinal cord on one side with the same structures on the opposite side of the midline. So, I'm going to show you that too. Maybe. Well, I won't be able to, I'll show it to you in gross anatomy. But, oh yes I can. Turn to page 53. Oh, but that's probably not the best. Okay. Turn the page, yeah, 52. Let me know when you have it. Okay, look at 52, because I want you to look at figure B. Okay, now you can see the same structure in figure A, but it's not labeled, so I can't point to it. So therefore, identify the corpus callosum. Look at the top of that figure and you see the word corpus callosum and it points down to that fiber. Everybody see that? You see the word commissural? Remember, by definition, a band of fiber connecting part of the brain or spinal cord on one side with the same structures on the opposite side. So now, you see the corpus callosum and those white fibers are called commissural fibers. The structures on the right hemisphere are connected to the structures on the left hemisphere by way of the corpus callosum. So this is a commissural fiber. Any questions? So if you divide this hemisphere in between right and left, you can see that that band is connecting. You can see the longitudinal fissure. Do y'all know what the longitudinal fissure is, by the way? I'm going to begin pointing in a minute on pictures. Do you understand? If not, it's okay, because I'm getting ready to change the slide. Okay. And when I change the slide, I think eventually I'm going to a picture. Let me change. Okay, so let me show you. Okay, so here. Now, I got to make my pencil work. Okay. All right, here. Oh no, that's the wrong color, because the picture is so colorful. I love my colorful pictures, guys. Okay, I'm talking to myself again. Okay, here. Can you see me drawing a blue line around this white structure? That's called the corpus callosum. Now what you're looking at, and that's a commissural fiber, you're only looking at one hemisphere, correct? So if you were to, and you're looking at a sagittal view, sagittal meaning that the brain is divided into the right hemisphere and the left hemisphere, but in this case, you're looking at the right hemisphere. So here is the frontal lobe, where this green is the frontal lobe. This is the parietal lobe, where I'm drawing, where you see the precuneus and the paracentral lobule. And then here is the occipital lobe, where you see the cuneus and the lingual gyrus. Okay, yes. Okay. Michelle.
So as I'm looking at the image on my screen, to the right of us, that's the front part of the brain, correct? The frontal.
Yes, the frontal, where you see superior frontal gyrus, yes. In that green, that's the frontal lobe.
Okay, so, but it seems like then that would be the left side of the brain that we're looking at then. Like, I feel like I'm looking at it different.
Oh, yeah, you are. It is the left side. I'm sorry, and thank you for the correction.
Oh, good.
Yeah, I said right, but I meant left. That's the left.
All right.
Okay.
Thank you.
Yeah, I apologize, and thank you. Okay. All right, so now, do you see the corpus callosum? Okay, I'm sorry. The corpus callosum is where I'm drawing now. I'm coloring. It's got a whole, here, I've colored it more and it's blue. This whole structure here. Now, I don't know if you, when I'm coloring, I don't know if you can actually see what I'm coloring until I finish. Do you see what I've just colored blue? If everybody sees it, that's a commissural fiber. Now, if I were to take the right hemisphere and add it, you wouldn't see the corpus callosum, but those fibers connect structures in the left hemisphere with structures in the right hemisphere. And that's what commissural fibers do. Everybody got it? So commissural means to connect from one hemisphere to the other. Oh, by the way, the white fibers are the axons of the. Did y'all learn what a neuron was in anatomy and physiology? Okay, good. So a neuron has dendrites. It has a cell body. And hold on for a minute, guys. Hold on. I got to take this because it's my mother, and I just lost my dad in August, so I got to deal. Hold on for 1 minute, please. Okay, guys, I'm back, and somebody's mic is on, but I don't know whose mic. Oh, Joshua, I think your mic is on. Okay, so, and I apologize, guys. My mother and Dad were married 67 years, and this is quite a tremendous loss for all of us, but when she calls me 3 times in a row, I have to pick up to make sure she's all right. She's by herself, and she's in South Carolina. And I just had her for 2 weeks, and she is losing a little bit of her cognitive skills. So, for example, she went home. She wanted to go home, so we took her home Monday, and she called me back and said, I wanted to go home to check my mail, and I've checked my mail. Now you can come back and get me. And I'm 8 hours away. So I'm like, okay, that's not going to happen. But I am actually, and thank you so much, I'm actually taking her to Colorado next week. But the constant, we normally talk late at night, so her calling me 3 times had me a bit concerned. Now she's not picking up. If she calls back, I'm going to have to take the call. Okay, but it won't be long. Okay, let's move on to, somebody asked were there other commissural fibers, and the answer is yes. There's the anterior commissure, and then there's the posterior commissure. The anterior commissure connects structures that deal with the olfactory tract. And then the posterior commissure connects structures that deal with the visual system. Okay. So now, yeah, that's okay, because you guys are going to learn, you'll learn a lot of new terminology. Yes,
okay, I
Michelle?
have one more question, and I apologize for bringing this up because this was from last week, but while I'm thinking about it, I wanted to go ahead and ask. Okay.
Oh, well, no apologies. Ask any questions. That's why I'm here. Okay, go ahead.
Remember when we were talking about, or when you were addressing the fibers, that helped connect
right
with the right and the left brain, like information. Okay.
That's right.
Are those
That's exactly
fibers located in the white matter?
Oh, okay, that's what I was talking about. I'm so glad you brought me back on topic. Thank you for asking that question. All of the fibers are white matter, and white matter is the axons. Okay, so remember I asked, did you know the structure of the neuron?
Yes.
So the gray matter would be the cell bodies of the neuron, but the white matter is always the axons. So those fibers we're talking about are axons.
Okay, that's making more sense. Okay, good.
Okay.
Thank you.
So and we do, and I'm glad you mentioned that. I forget I mentioned that last week. We talked about the association fibers, the projection fibers, and the commissural fibers. So the commissural fibers are those fibers that connect structures in the left hemisphere to structures in the right hemisphere. Okay, like the corpus callosum, the anterior commissure, and the posterior commissure. The projection fibers are those fibers that project from the cerebral cortex down into the brain stem and then on down to the spinal cord to go out to through the peripheral nervous system to some muscle or gland. Example of projection fibers would be the corona radiata. A corona meaning crown, radiant crown. And then the association fibers are those axons or the white matter that connects like an area, like let's say in the frontal lobe to an area in the temporal lobe or parietal lobe or occipital lobe, but in one hemisphere, on the same side of the brain. Okay? And so the gray matter in the neurons is the cell body. So what you have in a neuron is you have the dendrites, you have the cell body, which consists of the organelles, the nucleus, the nucleolus, mitochondria, blah, 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 blah. We're going to talk about that tonight, lysosomes. And then what you have is the axon. And at the end of the axon, you have the telodendromes, which contain a terminal bouton, which has neurotransmitters in them. So when we're talking about these fibers, we're referring to the axons or the white matter. Okay? And this, yes, Michelle.
Just one more. I just want to make sure that I've got this right about the white matter.
Mm-hmm.
Okay, so the white matter I was thinking was like a blanket that covered these fibers, that allowed it to flow from one side to the other. But that's not it, right?
No, that's not it.
Okay.
It's not a blanket. Think about
that. For some reason,
the covering, okay, yeah. The white matter would be the axons that travel from one area to another area. And axons could be very short or they could be long. Axons can extend from your head down to your toe.
Mm-hmm.
Or they can extend from the frontal lobe to the parietal lobe. But the message is sent through the axons. The axons are, yeah. I'll just show it to you. So let me see. Turn on page. It's easier if you can see the fibers. Okay. Turn to page. First of all, turn to page 77. And when you get on page 77, look at figure 238. And you're looking at, you see this fan-like structure and these fibers going down into the brain stem. Okay, those are axons. but they fan out like a radiant, and they're right underneath the cerebral cortex. In other words, if I were to remove the meninges, what I have is gray matter. But if I remove the gray matter, what I have is white matter, and that's the axon. So what you have is the cell bodies, and from the cell bodies you have the axon extends from the cell bodies in a normal, like look on page, let's look at the axon neuron. Now this will be very clear when we do, because of my gross anatomy slides, I just actually kind of remove things. I just remove structures off the top of structures. But because I don't have those slides up, please turn to page 15 and keep 74 available. And then we're going to turn to another figure. On page 15, you see figure 1.5 is a typical nerve cell with its major structures, right? Everybody sees that. Okay. So what you see is your dendrites, and your dendrites lead right to this cell body. That cell body is all gray matter. Okay. It contains the nucleus, the nucleolus, so forth. But right off of that gray matter, you have what? This axon, and that axon is all white fibers. So think about the brain being covered in this gray matter. And I can even show you, I'll show you another picture, but that's the concept I want you to get. The cell body is gray, the axons are white. If you look on page 74, you're looking at the corona radiata, which is a projection fiber. But those are all, the brain has billions of neurons. So these are axons from multiple, gobs and gobs of neurons. So what they've done is they removed the cerebral cortex, the gray matter, to just show you the white matter. And these white fibers are projecting down into the brainstem. So that it's not a covering, it's actually the covering has been removed to reveal the white matter. Okay? The covering would be and if you turn on page now, look at 76 and look at figure 239 down at the bottom. You can see in figure B, that's what I need you to attend to. Look at the colored part of the cerebral cortex. And then look at the white area. The colored part, or the dark gray part, the top of the, let's say the outline of this brain structure, and by the way, you're looking at a coronal section. The brain is cut from the front to the back. So what you see is the gray matter surrounding this white matter. Now, that white matter that you see at the top, you see the longitudinal fissure, the little fissure that divides the left side and the right. Those are axons. So what you see is projection fiber, the corona radiata, radiating from the cerebral cortex, and then you see the corpus callosum, which are axons, the commissural fibers, connecting the right side to the left side. Now, let me see if I have another picture. Does that make sense? No? Can you guys see what I'm talking about? Okay. Now, if you look on page 77, they are showing you, again, now they're showing you association fibers, the projection fibers, but you cannot see commissural fibers in here. So now look at the superior longitudinal fasciculus. It's connecting fibers from the area of the occipital parietal lobe, okay? And if you move the corona radiata, those fibers might project onto the front part of the brain. So you see association fibers and you see projection fibers. Now if you look at figure B, You see the corpus callosum, which is a commissure fiber. But you also see the white fibers right above the cingulum, and those are, that's the corona radiata. Everybody, does that make sense when you look at those pictures? Those are three different types of fibers. They're all white, and it's the axons that you're looking at. Anything that's dark in color is a cell body. Okay. And I really need to have it in front of me so I know that you understand what you're looking at. But Michelle, does that kind of help some? Everybody else? Okay, so so when you see commissural, I want you to think one side, this axon is connecting one structure in the right hemisphere to another, to the same structure in the left hemisphere. That's what I want you to think about, okay? All right. Okay, some more terms. Somites. Well, we have a neural tube, and the brain develops out of the brain develops from a neural tube, and so these are just mesodermal types of tissue blocks that are on the outside of the neural tube, and I'll show you a picture of that. We won't talk a lot about somites, but if you see the word somites, think about embryology and neural development, how the brain develops. Somatic structures include most axoskeletal and associated muscles that are derived from the somites. So the skeletal structures are derived from the somites. So if we're talking about somatic, we're talking about those skeletal structures that are derived from those little tissue blocks. Visceral refers to the internal organs that contain non-striated muscles. So your digestive system, your visceral, when we talk about visceral, we're talking about your digestive system, your respiratory system, your urogenital organs, your spleen. Now, your heart is visceral, but it is striated, okay? Let's see. So I think I have a picture of somites. So this is a neural tube. That's what the brain the components of the brain develop out of this neural tube. And we're going to talk about those divisions, but I want you to look on page, all this is chapter 2 kind of stuff. If you look on page 37, and look at figure 2.2. Okay, and so if you look at figure B, then this is showing you how the brain and the central nervous system actually develops. And so it develops from this neural tube. And the neural tube then can be divided into various vesicles or major brain divisions, which you're going to have to learn. So the neural tube develops into the prosencephalon, which consists of the telencephalon, which is the cerebral hemispheres, the cerebrum, the diencephalon, which is the thalamus and the hypothalamus, and then what you see is the metin and meson and myelencephalon, and that's the brain stem. Okay? So when we look at this neural tube that's in front of you, the brain is going to the central nervous system is going to develop in a manner that the structures actually turn into primary vesicles and into these various divisions. And the somites, the skeletal muscles develop from the somites, which are those little block tubes. Okay. When you look at figure 2.2, where you see the midbrain flexure, everybody see that? In figure B, 2.2b. Okay, that's the beginning of the development of the brainstem. And that midbrain flexure is called the mesencephalon. It's not saying it right there, but that's what it is. Then you see a raise or a bump that's called the metencephalon. That actually is the pons. That's developing into the pons. And right there beside it you see the pontine flexure. Then as that structure curves on around, it becomes the myelencephalon, and that actually becomes the medulla oblongata. And then at the bottom of the myelencephalon, you see the spinal cord. Okay? Now, the mesencephalon and the myelencephalon together is called a primary vesicle division called the rhombencephalon, and this is considered to be the hindbrain. So you've got three areas of the brain that actually develop embryonically. You've got the forebrain, which is like the cerebral cortex, and that's called the prosencephalon, and it consists of two divisions called the telencephalon and the diencephalon. The telencephalon is actually the cerebral cortex. The diencephalon is the thalamus and the hypothalamus. The thalamus is important for integrating all incoming sensory and motor information. It integrates everything coming through the brain and going out of the brain. The diencephalon is very important because it contains also the hypothalamus, and the hypothalamus is important for eating, drinking, so hunger, thirst, sexual appetite, homeostasis, making sure that your temperature, your body temperature is appropriate, the way you respond to things emotionally. So that's part of the prosencephalon, the diencephalon. And you'll learn all of this when we talk about Chapter 2. We're going to talk about Chapter 5 first. But this is just trying to give you some example of what you're looking at. You're looking at a neural tube that will develop into a prosencephalon, a mesencephalon, which is the midbrain, and a rhombencephalon, which is the hindbrain. So just, you know, kind of for your information. And somites are tissue blocks out of which structures develop, like, for example, your skeletal muscles, which is why we call them the somatic muscles. Okay, any questions thus far, guys? Anybody have any questions? I know it's a lot to learn. Now, we talked about visceral, so all of these organs that you see in front of you here, like your genital area here, your stomach area here, all of these are visceral organs. All of these are visceral organs. Okay? So that's what we mean by visceral. And they're involuntary. Okay. Okay, any questions about anything we talked about thus far? Everybody good? Okay, so now let's just look at some other terms that you need to learn. Inter means between, like interhemispheric, between both hemispheres. Intra means within. So intrahemispheric means within the same, like, hemisphere, like the right hemisphere or the, you know, within the left hemisphere. Contra means opposite. So contralateral, and we talked about that principle. The right hemisphere controls the left side of the body. The left hemisphere controls the right side of the body. So there's contralateral, you know, there's the principle of contralateral control. Pre meaning before, post meaning after. And then transient. These are symptoms that revolve quickly. So, for example, let's say somebody has a transient ischemia attack. Have you ever heard of a TIA before? Transient ischemia attack? Okay, a transient ischemia attack, since several people have, and some people said no. That's when you're having the symptoms of a stroke. For example, it's transient, so it means that it resolves. So let's say, if I can draw, let's say that this is an artery. and I have a blockage, and I'm going to make the blockage a different color. Oh, wow. That's terrible, but I'm glad that you can recognize them. Okay, so let's say I have a blockage. Here's my blockage right here. Guys, let me know that you can see what I'm drawing. Okay. Yes, okay, there's the blockage. Now, I'm going to change this color to red. So the blood is, well, it's not really red, but it don't matter. So when it gets here, the blood narrows, and the blood starts to back up. But when it's here, when it gets past there, it's fine. The whole artery. I'm trying to do this with the, flows, but you can see that there's a narrowing of the bloodstream. Okay? So what happens when there's a narrowing of this bloodstream? That means that the person is going to start having some symptoms of the fact that only a small amount of blood is able to get by until, so when the blood stops where that blockage is, when it's trying to get past that, right there, that person might have blurred vision. The person may have some asymmetry of the face. The person may not be able to speak or comprehend. And the reason that the person can't do it is because the blood is going through that area where the blockage is. Remember, we talked about ischemic. This is what we call an ischemic problem. It's a blockage, ischemic. This might be a thrombosis. It's just a stationary block. So what happens is the person is having these symptoms, but all of a sudden the blood is able to get through, and now the blood flow is flowing normally. So the symptoms resolve. So they may have symptoms for 10 minutes, 20 minutes, 30 minutes, but after that, everything goes normal again. So this is what we mean transient. Transient means that the symptoms resolve very quickly. And that's why we call this a transient ischemic. Ischemic refers to blockage. Transient. It's going to resolve quickly, but there's a blockage that stops the blood flow from getting where it needs to go. Okay, and so your body is telling you that there is a problem. Okay, so you can do one or two things. You can do nothing about it, and then that's your warning that you're going to have a major stroke. What you need to do is get to a doctor immediately, quick, fast, and in a hurry, and let them use a clot buster to break that clot up so that the blood can flow through that artery. So somebody said that their client, let me see, Rachel, you said one of my elderly residents gets them a lot. So if you can tell that she's having one, unless she's having a seizure, she needs to be checked immediately, because that's your warning sign that she's going to stroke eventually. Okay? Does that make sense? So does everybody understand transient? If you do, please respond. Okay. Yeah, Rachel, don't take that lightly. If you see her, either she's doing one or two things. She's having a seizure or she's having a TIA. If she's having a TIA, she needs help immediately. And if you can get the help immediately, then they might be able to dissolve the clot and then head off a major stroke. Okay. Let's see. Persistent means that the symptoms don't resolve quickly. They're there. So like, for example, my mom has what we call a pannus. A pannus is a growth it's a very, very, very slow growing piece of tissue that's growing from the cervical area of the spinal cord, growing from the soft tissue of the cervical area of the spinal cord into the spinal cord. And so she has some persistent symptoms. They don't resolve quickly. They don't, you know, they persist. I mean, they constantly occur. And imagine so we have a neurosurgeon that's watching her at 85, 83. She's 83. Nobody's going to do surgery because that would be more dangerous than following her. But persistent means that it's constantly there. It just doesn't resolve quickly. Static or stationary. Oh, okay, that's fine, Rachel, but you can't really try to prevent them. If they're happening because there's something neurologically going on. So she probably needs a good neurological workup, I would think. Okay. Static or stationary, symptoms that reach a maximum severity and they do not resolve. Okay. So I have a problem with my knee. My knee, it hadn't gotten any worse, but it ain't getting any better. It's not going to resolve. Improving means that you had these symptoms, but you got better. And they may not ever come back because you got the appropriate treatment. Progressive means that the symptoms continue to worsen. Okay? Any questions about that terminology? Okay. Acute means that the symptoms resolve over minutes to hours. Subacute, they develop over days to weeks. And chronic means that they develop over months to years. So that's like me having arthritis and it gets, you know, it develops over a period of years and then it just may get progressively worse, but it's always going to be there. And it's taken a long time for that to happen. Okay. So these are terms that are related to the cells and cell function. The neurons, that's the gray matters. The axon, and really the axons are the white matter and the dendrites. So dendrites are white matter and axons are white matter. Okay? Glia cells, we have two kinds of cells. We have neurons and then we have glia cells. Glia cells protect and support the nerve cells. The cell body is called the soma. It contains the cytoplasma. Cytoplasma is just the liquid or the gel or the fluid that the nucleus, the nucleolus, and all these organelles are in, such as the mitochondria. Mitochondria is the powerhouse. It supplies the cell with energy and glycogen and ATP, which is very important for the neuron to live. The ribosomes synthesize proteins, and the rough endoplasmic reticulum, they actually serve sort of like as highways. They're like a series of tunnels or sacs by which things that need to get into the cytoplasma are carried, through which the Golgi complex, all of these things are part of the cell body. The Golgi complex actually serves like a UPS, like a package, like people work for UPS, so they have to sort packages, they have to sort them, and they have to put them in their particular order and so forth and so on. So the Golgi body actually sorts various proteins and packages them to go to various parts of the cell. So in order for a neuron to live, the rough endoplasma, well, the endoplasma reticulum, it's actually like a highway in which proteins and things that need to get into the cytoplasma are able to travel. Now we're going to talk about this when we talk about the neurons, and I'm going to show you a very good video on this tonight, but I'm just giving you examples of when we say cell bodies, we're actually talking about, if you look again on page 15, we're actually talking about gray area, which has the nucleus, and all these, the cytoplasm. The cytoplasm has all these organelles in them, and all of them serve a function. And the function is for them to develop protein. We're made up, our body is made up of protein and glycogen. Protein is sugar. And without those things, glycogen actually we can't get it from the bloodstream. So it's developed in that cell body area, in the mitochondria. But without it, neurons die. And if neurons die, then things don't work right. So these are just terms related to the cell and their function that I want you to be familiar with. The axon helix, if you look at 16, you see 15, you see the axon. But the helix is actually the raised area that comes off of the cell body. It's where the axon arises from the cell body as an elevation. If you look at the axon, at the end of the axon, we have something called the synaptic terminals, where you have the terminal boutons. The boutons can be called buttons or knobs. And so you see that in that button or terminal bouton at the end, you have something called the neurotransmitter. So this is the end portion of the axon that contains many vesicles that release neurotransmitters between the end portions of the axon and the surface of the next nerve cell. So I want you to think of the dendrites as being sensory because they receive information, and the axon is being more motor. So the dendrites is being afferent, A-F-F-E-R-E-N-T, and the axon is being efferent, E-F-F-E-R-E-N-T. Okay, let's see. Let's go back here. We have the synaptic cleft. That's the space between the end of the axon and the surface of the next nerve cell. And so if you look on page 15, you can see the synaptic cleft. And then you have the presynaptic nerve cell. This is a neuron that ends at the synapse. Okay? And so then you have the postsynaptic neuron, and that's the neuron that receives an impulse from the presynaptic neuron. So if you're looking on page 15, this typical nerve cell where you have the dendrite, the cell body, the axons, it ends at then you have the terminal bouton. That's the presynaptic nerve cell. And then what you have is the postsynaptic nerve cell where you see dendrites again. It just doesn't show you it shows you the dendrites, the cell body, and a little part of the axon. Okay? Then an impulse can travel in two directions. It can either travel from the cell body to the axon terminal. So, information came into the dendrites. It was sent through the cell body, then to the axon. So we call that anterograde. Okay? And then information can flow in the opposite direction. Information can flow from the axon terminal back to the cell body. So a lot of times, like, we might have receptors or vesicles that are in the area where the terminal bouton is, and what happens is after the neuron fires some neurotransmitter, the neurotransmitter is either going to be excitatory, so it will keep the impulse going on to the next or the postsynaptic neuron, or it will be inhibitory. The neurotransmitter will fire, but nothing will happen to the postsynaptic neuron. You may have a breakdown of vesicles or tubes that then are sent back from the axon back to the cell body where they are degraded or they are rebuilt. And so if that happens, then this is called retrograde. So the flow is from the axonal terminal to the cell body. So if it's going from the cell body to the axon, it's anterior grade. If it's going from the axon back to the cell body is retrograde. And then we have neurotransmitters, and these are chemicals that are synthesized in the cell bodies or in the synaptic terminals. And so I want to show you now that here is, let's go back to the blue. I like the blue for some reason. Okay, so this is a typical axon in here. Oh, that's pink. I need to change that. Okay. So here are your dendrites. All of these are your dendrites that I'm drawing in blue. And you can see that those dendrites lead to this beautiful cell body with all of these organelles in it. So here is mitochondria. It's hard to see that. But the green little circle is the nucleolus, and the orange area or the yellow area is the nucleus. So these are outlined for you. You can see that within this cell body here, you got lots of organelles. You have ribosomes, you have Golgi apparatus, rough reticular endoreticular plasma, so forth, which is also called a missile body. Then off of that, here is the axon helix, and then here is the axon. And you can see here are the receptors on the next axon. So they're either going to receive from this terminal bouton, they're going to receive some type of neurochemical, or they're going to, and it's going to either be excitatory or inhibitory. Okay? And then within this area of the axon, you can also see microtubules, neurofibrils, so forth. All of these things are they transmit or they transport. Okay? So this is a typical axon. And cell body in dendrite, so a typical neuron. Okay. Nucleus, I need you guys to pay attention to this and look on page 16 and look at table 1.7 because this terminology is coming from the table, so you can use this table to help you learn it. But nucleus or cell column, these are what we call cell nerves in the central nervous system. So if I'm talking about a nucleus, I'm talking about the central nervous system. We know we have a central nervous system and we have a peripheral nervous system. If I'm talking about a ganglion, I'm talking about a collection of nerve cells in the peripheral nervous system. So nucleus is always going to be central nervous system, which consists of the brain and the spinal cord, but ganglion always refers to a collection of nerve cells in the peripheral nervous system, which consists of the spinal nerves and the cranial nerves. Okay? Cranial nerves come off the brain stem. The spinal nerves come off of the spinal cord. Autonomic nervous system, this refers to motor ganglion, which contains cell bodies of fibers that supply smooth muscles and glands. So if we're talking about the autonomic nervous system, we're talking about the sympathetic nervous system or the parasympathetic nervous system. If it's sympathetic, it causes you to really fight or run. That's when your heart starts to race. That's when your pupils dilate, your hands get sweaty. But if we talk about parasympathetic, which is part of the autonomic peripheral nervous system, we're talking about the fact that you are then, everything is going back to normal. Your pupils are no longer dilated. You're no longer sweating. Your heart rate goes back to normal. Okay, so when we talk about the autonomic nervous system, that's what we're talking about. Tract or fasciculus is a collection of nerve fibers that share the same common origin in the CNS. So, for example, we have a tract called the cortical spinal tract. So that means that a tract, or those fibers, are the axons. They begin, the tracts are named from where they begin and where they end. So if it's a cortical spinal tract, it means that the fibers actually run from the cerebrum, or the cerebral cortex, down through the spinal cord. Okay, and if it does that, it has to be an efferent tract or a motor tract, because because information is coming from the cerebrum, going through the spinal cord, out through the peripheral nervous system to a muscle or a gland to cause some type of movement to occur. So when we talk about tract or fasciculus, it refers to nerve fibers that share a common origin in the central nervous system. Okay. Jenna, when you say, is that the fight or flight, what do you mean? When we talk about fight or flight, yes, autonomic nervous system, absolutely. The autonomic nervous system can be broken down into the sympathetic and the parasympathetic. And let me show you this so that you can mark this in your book, please, because you have to learn this. So if you look on page 36, everybody let me know when you are on page 36. Okay, so what we're looking at is the nervous system, and it's broken down into the central nervous system and the peripheral nervous system, which the central consists of the brain and the spinal cord. So you see a beautiful picture of that figure 2.1a. But if you look at figure 2.1b, now you see those peripheral nerves coming off of the brain stem and off of the spinal cord. And the peripheral nervous system can be divided into the somatic nervous system. Remember, we said the somatic nervous system, what is made from the somatic nervous system? What develops from the somites? We said the skeletal muscles. So it's voluntary from the standpoint that the somatic nervous system, even though it's peripheral, we're talking about the skeletal muscles. So you've got sensory and motor nerves that innervate the muscles and the skin. Very voluntary. If I want to flex my muscle, I'm talking about the somatic nervous system, but that's the peripheral nervous system. But I'm controlling the flexing of my muscles or the pointing of my finger, okay? But what we also have is the autonomic nervous system, which is involuntary, and this is also part of the peripheral nervous system. So what we have is sensory and motor nerves that innervate your visceral organs. And remember, the visceral organs pertain to the respiratory system, the digestive system, the urogenital system, so forth and so on. All those things are involuntary. So when we start talking about the autonomic nervous system, we can break that down into the sympathetic nervous system, which expends body energy by activating those visceral organs, causing them to, like the heart, just to race out of control, and my stomach just to get queasy. And, you know, like somebody gets really afraid and then they wet their pants, they urinate in their pants. That is the sympathetic nervous system. It causes those glands to just go out of control. That's because you're afraid, you're running from something, you can't control it. And then, of course, the other part of the autonomic nervous system is the parasympathetic system. And this is the system that conserves energy as opposed to the sympathetic nervous system that expends energy. Okay? Yeah, Julie. So visceral it is internal, but it also refers to the sympathetic, it's affected by the sympathetic nervous system. It's part of the sympathetic nervous system in the sense that those visceral organs are just out of control. And in fact, now that I'm thinking about that, can anybody think of a time that you were afraid of something and what happened? Anybody can raise their hand and answer that. Genuine fear. What happened to your body? Raise your hand. Okay, Kendra.
I have a weird response to fear. I don't do fight or flight. I do freeze. So whenever I get really, really scared, I will fall down.
Okay, that is amazing. And I was in that situation too in New York, where I was scared because somebody jumped a turnstile, and this guy started cursing at the person. I was with the person, actually. We was a group of us there visiting a corporation. I couldn't move. So I was like you. I just stood there. And the people I was with, they pulled me onto the subway was coming, so they pulled me on the subway. But somebody else, what have you experienced when you've been really, really afraid? Because this is the autonomic nervous system. It's the sympathetic nervous system that goes into action. Anybody else? Raise your hand. Okay, Nicole says shake, sweating, breathe harder, heart rate increases. Okay, good. And then when you feel like the fear is gone, everything comes back to normal. All of those visceral organs then go back to normal levels. And so this is what we call the parasympathetic system. So remember that the peripheral nervous system consists of the somatic nervous system, somatic meaning related to the skeletal muscles and skin. Okay? You can control what happens there. But the autonomic nervous system, very involuntary. So sympathetic and parasympathetic systems are components of that. Okay? All right. Everybody got it? Brachium is a bundle of connecting pathways. And we'll talk about the brachium when we talk about the pathways. Like, how does information get from the brainstem to the cerebellum? Well, it goes through the superior cerebellopeduncle, the inferior cerebellopeduncle, or the middle cerebellopeduncle. And so several of these pathways are called brachiums. And so this is a bundle of connecting pathways for the pathways connecting the cerebellum to the brainstem. I can't say that word. Somebody say that word for me. I have apraxia. Whenever I see it, I can't say it, but if you say it, I can say it. But it refers to color, band, or texture. Help me out, guys. Joshua, you know what I'm talking about because I taught you before. Apraxia occurs when you can't program the muscles. It's not a weakness to say what you want to say, but if somebody says it, you can say it. Okay, say it for me, Angela.
Is it stria, like striated?
Yeah, thank you. Thank you, stria. I cannot say that. Every time I see it, I block on it. But if you say it, I can say it. That's part of my apraxics, and you'll see me do that a lot. Hopefully not too much. Thank you so much. But that denotes the band of fibers that they're just different in color and texture. Like I showed you the heart, and I showed you those fibers, and they were red in texture. Okay. Colliculus refers to a small prominence of the nervous system tissue. So, like, we have the inferior and superior colliculus, and I'm going to show them to you. It's a prominence off of the brainstem. And if you will turn to page 56, you can also see the brachium. Okay, so if you look at page 56, and let me know when you have page 56, look at figure 221. Okay, good. If you got it, look at figure 221, And at the top you'll see the pineal body, and that's the pineal gland. Important for wake, sleep cycle, it makes melatonin, so forth. But right under that you see this little raised area is called the brachium. And then if you come down, right below that you'll see the superior colliculus and the inferior colliculus. So this is what we mean by the small prominence of the central nervous system tissue. It bulges out. The superior colliculus is important for visual reflexes. The inferior colliculus is important for auditory reflexes. This is on the dorsal or back side of the brain stem, okay, where you can see the superior and inferior colliculus. But look at the cerebellar peduncles, superior, middle, and inferior. Those are the areas. The brachium is that, like, all those, it's where all those paths kind of come together, and then they divide into these fiber tracts that go from the brainstem into the cerebellum. So this is how information gets from the cerebral cortex into the brainstem into the cerebellum. And why do I need to communicate with the cerebellum? Well, the cerebellum is important for proprioception, and it's important for balance, and it's important for fine skill movements. So have you ever been in a situation where you were about to fall but you didn't? Like you tripped, but you didn't actually hit the floor. Has that happened to anybody? Well, the reason you didn't hit the floor was because the cerebellum corrected your movement. That's what it does. But it was unconscious. So the cerebellum is important for skilled movement. But that information had to come from the from the cerebral cortex going to the brainstem and going to the cerebellum to say, correct that movement and keep that girl from falling, or guy. So how did the information get there? Well, the cerebellum is communicating with the brainstem and the cerebral cortex through these cerebellar peduncles. And that information comes through the brachium a lot before it gets to the peduncle. So this is the brachium, again, is a bundle of connecting pathways for the pathways connecting the cerebellum to the brainstem. So information is coming through the brachium, being sent through the brainstem, and then going into the cerebellar peduncles, be it the superior, middle, or inferior peduncle. And it depends on what the track, what information is necessary in terms of what the track is supposed to do. Okay, we have a nerve or nerve trunk. When we talk about a nerve trunk, we're referring to a bundle of fibers in the peripheral nervous system. An axle always refers to the central part of the body, and it's made up of the head and the trunk. So if I'm talking about the axle, I'm talking about the trunk and the head. Appendicular refers to the limbs which are attached to the axle structures, which are the trunk and the head. And I believe, class, that is the end of lecture 1. So, how you guys doing? So what you need to do is learn the terminology, read chapter 1, look at the tables in chapter 1. You got to read it, but you got to learn the terminology, okay? The other thing I want to point out to you in chapter 1, and we'll talk more about this when we get into chapter 2. Oh, overwhelmed already? Okay. I promise you it's going to be okay. All right, Nikki, so you're going to be fine, okay? It's a lot, I know, but it's nothing that you cannot learn. I would like for you to look at chapter 1 and look at page 18. And what you're looking at is the function of the brain structures in the spinal cord. Okay? Now, we've been talking a lot about the cerebrum, and we know the cerebrum refers to the cerebral hemisphere. When you think about the cerebrum, I want you to think about the fact that all higher mental functions occur at the level of the cerebrum. We talked about there being a hierarchy, all right, of functioning in the brain and the central nervous system. We said that the central nervous system consists of the spinal cord and the cerebrum, but the spinal cord is reflexive in nature, so that's the lowest level of functioning. In other words, if I put my hand on a hot stove, I'm not going to wait until that information gets sent to my brain to be interpreted. I'm automatically going to remove my hand. That's what we call a reflex. And in the spinal cord, we have a reflex arc. But at the level of the cerebrum, that's where language is, and memory, and executive functioning, and reasoning, and inhibition of inappropriate behavior. And so that's the function of the cerebral hemisphere, to integrate all incoming sensory motor information and to interpret all types of experiences that we have. The limbic lobe, we'll look to see where that is, but that's the oldest part of the brain. And this is where all that emotion, you know, everybody's yelling and screaming and you can't control your emotion. You just go off the chain. That's because that's a function of the limbic lobe, and this is the oldest part of the brain, and that really contains the, I can't even think of what it contains right now because I can see it, but I can't think about it. Hippocampus, I'm sorry. The hippocampus, the parahippocampus, the cingulate gyrus, you'll learn where these structures are. All of that is part of the limbic lobe. The basal ganglia. The basal ganglia is deep cortical structure. So when I showed you the commissural fiber, which was the corpus callosum, if you turn to page I actually want to label the structures for you. But if you turn to page like 78, okay, and you look down at figure 241B, you see that there is a structure called the septum pellucidum. That structure divides the lateral ventricles of the anterior horn. So let me know that you see the lateral ventricles, which are directly under the corpus callosum. It's the space that's there. Okay, and what divides the lateral ventricles is the septum pellucidum. But right under the floor of the lateral ventricle is dark tissue. It's just dark or gray matter. That's the basal ganglia. All that gray matter below those ventricles is the basal ganglia. And so it's the caudate nucleus, it's the globus pallidus and the putamen, the colostrum, so forth. And we'll learn these structures. But when you look at this table again, and we talk about basal ganglia, those are structures that regulate your movement, motor movement, and muscle tone. That's the importance of the basal ganglia. So if, for example, you have a problem in that area, you will not be able to control your movements will be involuntary. So you might have a lot of shaking. You might not be able to stop, like throwing your hand up or throwing your arm up. So you might have like what we call dystonia, and that's inappropriate movement that you cannot stop or control. So that's the function of the basal ganglia, is to regulate or to control inappropriate movements, as well as to make sure that you have appropriate muscle tone. The diencephalon we talked a little bit about, and I said it contains the thalamus and the hypothalamus. And the thalamus is important for integrating all sensory and motor information coming in and going out of the brain. Hypothalamus regulates your body temperature, your food intake, water balance. So let's say, for example, I have anorexia. That's a problem with the hypothalamus, okay? Or I overeat. I eat too much. That's a problem with the hypothalamus. The cerebellum participates in the coordination of skill movements and regulation of equilibrium, helps you with your balance. The midbrain, it mediates auditory and visual reflexes. Hold on for a minute, guys. All right, I'm back. So, the midbrain, we said, is important for auditory and visual reflexes. And I showed you the superior and inferior colliculi. Those are part of the midbrain. The pons, we have all kinds of nuclei in the pons that are part of these tracts we're going to talk about. The medulla regulates respiration, phonation, heartbeat, and blood pressure. And then the spinal cord regulates reflexes. So these are some of the basic structures that we're going to learn and talk about. And so I need you to kind of be familiar with their function. And the last thing I want to point out to you in this chapter, well, really two things. Look on page 20, table 110. You should study it all, Angela. Study it all, because like this information you'll see in the second PowerPoint, but I want you to become familiar with it because it's chapter 1. So everything in the chapter, I want to point out to you, I need you to begin learning. Okay? All right. If you look at table 110, you do not have to learn like all of these layers, but what you need to know is that the gray matter is not just one layer of matter. It has at least, what, 6 different layers, okay? And some of the tracks actually begin in these layers. So, for example, the cortical spinal tract begins at the level of the pyramidal area, layer 3 and then layer 4, okay? And then I also want you to look at figure 1.8, and you see these numbers. You will have to learn these numbers. What happened is different cortical regions are labeled by numbers. So many times when you're talking to anybody in the area, like a neurologist or a medical speech pathologist, they don't refer to these structures by their names, but they might refer to them by their number. So if they say, for example, there's a problem in Brodmann's area 4, then you should know that Brodmann's area 4 is the primary motor cortex, okay? And if they say, well, there's an area in Brodmann's area 44, then that should immediately signal to you that that's Broca's area. So what you are going to have to do is learn the common Brodmann's areas. And if you look at table 111, then these numbers you're going to have to learn, okay? And so what right now I'm doing is table 1 is an overview, and it's giving you this information. When we talk about chapter 2, the same information in chapter 1 is going to be presented again in chapter 2. And so you'll have to learn the Brodmann's areas, the common Brodmann's areas, and you'll have to learn the function and these brain structures in table like 1.8. Table 1.9, forget about. Don't worry about that. I'm not worried about that from the standpoint of you just actually knowing what's general versus what's specific at this point, okay? But yes, you will have to memorize the Brodmann's numbers, because what happens is people are going to refer to the Brodmann's numbers. They might not name the structures. Like, for example, let's look at table 111, the precentral gyrus. Now, I am going to go over this again when we get to chapter 2, but the precentral gyrus, I don't know if you know the structures, where that is, but that's in the frontal lobe, and that's the primary motor cortex. So anytime anybody says Brodmann's area 4, then that's what you should think about. And that's where the homunculus, or that man, hangs upside down on the motor strip. And on that motor strip, it's important for movement. So if there's damage to any area, any part of area 4, Brodmann's area 4, somebody is not going to be able to move some structure depending on where the damage is. The area right in front of the precentral gyrus is the premotor cortex, and that's important for skill movements and for hand movements and so forth, and those are areas 6 and 8. So these areas, I'm pointing them out to you right now, but as we learn the structures, you're going to have to associate the numbers with them, okay? Guys, can you hear me? Oh, man. Okay, thank you. Oh, no, I'm so sorry. Okay, so I don't know what was the last thing you heard, but I said that you have to learn the Brodmann's areas, so did you hear that? Okay, and I also said look at table 112, because that lets you know that you need to learn the definition of some of these names, and you need to look at the visual appearance of the brain and look at the researchers' names. And the more you study the brain, the more you will be able to identify the structures. But you have to spend time really looking at the structures, learning the names, and seeing and learning the functions and seeing where those structures are in terms of location of one structure to the other. Okay? Any questions about this particular lecture and our chapter 1? Now, I was archiving this, so hopefully you can go back and look at the archives and listen, okay? Any questions? If no questions, it is 7:50 and we are going to take a 15-minute break that gives you an opportunity to get something to eat and to go to the bathroom. We will resume at 8:05, and we are going to be doing Chapter 5. Okay? All right, everybody, take your break. Okay, students, are you back? If you're back, please indicate by saying I'm here. Okay, so what I think I'm going to do is start off with a YouTube video first. I usually show it later, but give us a change of pace, because what we're going to be talking about is the neurons and associated cells in this lesson. And so if you haven't had a chance to read Chapter 5, please go ahead and read it now, okay? And then after we talk about the structure of the neuron, we'll also talk about then problems that we see in people who have problems with the neuron, like myasthenia gravis and multiple sclerosis and Guillain-Barré syndrome. Okay? But let's see if you can see this. So the, oh, I can't display this web. Okay, wait a minute. Let's do this again. Because I don't like that. I got to be able to, okay. Okay, so I'm going to YouTube, and I'm going to type in the neuron, and let's see, neurons and how they work. Neurons and how they work. Okay. Wait a minute. Oh, I keep trying. How they work. Okay, give me a minute, guys, because the one I want, I was just looking at, but I don't see it. So let me look at it again. Alright, let me try one more time. Bear with me for 1 minute. Let me go back. The title is actually in your PowerPoint presentation. So I want to look at that first. So when I go to the title, and that'll be up in a minute, if you can't see it, so here it is. I want to look at neurons and how they work. That's the YouTube video that we're going to look at right quick. So that is the title of it. Okay. Now let's try it again. Okay, so here it is. Okay. That's not it, guys. Wait a minute. I must have hit the wrong thing. Let me try it one more time. I'm having a problem, eh? I know. Let's not do that. That's not it. That's not it. Let's do it one more time. Okay. Let's try it again. Oh, I cannot believe I can't pull it up. I just had it up. All right. I'm not giving up. It's not going to defeat me. Jess was watching it. Okay. Go back to YouTube. Try this one more time. Okay. Now, I want to do this one right here. Okay, this is it, guys. So, now, can you guys see it?
Underneath the newfangled cortex, the brainstem, the limbic system, and the basal ganglia date back to the mastodons, the dinosaurs, and the first amphibians.
Okay.
The old parts of the brain oversee.
And if you can't see it, it's neurons and how they work.
They also form intimate connections with the new brain, the cortex. Though less than a quarter-inch thick, the cortex is the brain's crowning glory. Among its roles, the cortex is our reality chip. It filters and orders the outside world and allows us to see, touch, hear, and speak. The cortex is also the human thinking cap. All our plans, thoughts, and ideas originate in this layer. The cortex is packed with nerve cells. About 2/3 of all our neurons operate here. A piece of cortex tissue no larger than a pinhead can house 30,000 of these cells. Each neuron has a job to communicate with other neurons. The brain works by forming networks among these cells. The long, spiny branches of the networks create a neural forest of astounding intricacy. Neurons use these communication lines to talk to each other with electric and chemical signals. under microscope are two neurons linking up. Though it may look like they fuse together, neurons don't actually touch each other. A closer look reveals that a tiny gap called the synapse separates their branches. This is where a message passes from one neuron to the next. The message comes from here, small sacs that store chemical molecules. When stimulated, these sacs release their molecules which cross the cell membrane into the synaptic gap. An electric zap allows this to happen. Meantime, the receiving neuron has special welcome sites for the incoming molecules. These receptor sites bind with the molecules. When they do, special gates open up. The gates let in a flood of charged particles, sodium and potassium ions, which start up a new electrical signal in the receiving neuron. This simple chain of events, an electrical zap, followed by chemical changes, followed by another electrical zap, is the basis of all brain activity. It's how neurons speak to each other. Here, then, is the key to the brain's complexity. There are 100 billion neurons in the brain. Each neuron, like a bit player in a grand production, processes its information, then hooks up with as many as 50,000 other neurons to send and receive messages. 100 billion neurons times 50,000 connections. It's this complexity that allows us to think imaginatively. On their own, neurons aren't very bright, but put 100 billion of them together in a small space and let them all start talking to each other, and you start to get brainstorming. The trillions of neural networks, like an improvisational orchestra, create new ideas and connect different thoughts in a whimsical and sometimes inspired fashion. It's this impromptu ability to produce new things in our brains that allows us to progress. It quite simply takes us from here to here.
Okay, so did you guys get an opportunity to see that? Could everybody see the video? I hope so. Oh, that was good. And you could hear it too? Okay. All right, good. So what we're going to talk about is the neurons and associated cells. And I just wanted to show you that we are made up of billions and billions of neurons. And we're going to just talk about what is the function of the neuron, what are the structures of the neuron, and then what are problems that we see when there's a problem with the neuron. And I think that the reason I go to chapter 5 is because the brain is made up of neurons, so that's the basic functional unit of the neurological system. So it's the basic unit of the nervous system. It is in synaptic contact with its processes and other neurons. So you saw neurons communicating with other neurons in order for the brain to function and for you to be able to interpret and to speak, to think, to do all of those higher order types of things that are important for you to live. So a neuron is designed to react to stimuli, to transmit the resulting excitation rapidly to other portions of the cell. So in other words, if a stimuli like touch occurs, then a neuron responds so that that information is interpreted in the brain so that you know what it is that's touching you. So if the neuron didn't respond, then you wouldn't be able to feel, you wouldn't be able to move, and you wouldn't be able to function. So a neuron is designed to influence other neurons, to influence muscle cells, to influence glandular cells. So that being said, it is just the basis of everything that we do. So neurons are also not, I guess I want to say is they're unique, but some of them are very specialized. They're very diverse. So they come in all forms, they come in all sizes. But even though they are specialized, depending on whether it's a motor neuron or a sensory neuron or an interneuron, then they all consist of the same basic types of structures. The cell body, or soma, an axon, which we already looked at the structure of the neuron tonight, but we know the axon extends from the cell body, and then dendrites. And we said that the dendrites receive information, they send that information to the cell body. The information is sent from the cell body, in many cases, to the axon. And then, of course, a neurotransmitter is released across the synaptic cleft, and then either the information in terms of the neurotransmitter is either going to be excitatory or it's going to be inhibitory. But all neurons have these basic types of structures. And so here we have the dendrites in purple. We have the nucleus of the cell body, so this is the cell body. We have the axon helix here. And if you notice, this axon has actually myelin sheets on it. And we're going to talk about, well, how are those myelin sheets made? What types of cells are used to develop myelin sheets in the central nervous system versus the peripheral nervous system? In between these myelin sheets, we have what we call the nodes of Ranvier. And the point of the myelin sheets is to help with the speed of conduction. Okay? At the end of the axon, we always have these axon terminal branches, and then we have those terminal boutons that have neurochemicals in them. Again, some of the neurochemicals are excitatory, so they cause action to occur, or they're inhibitory, so nothing happens. We see this word Schwann cell. Schwann cells are an indication that the myelin sheath is produced, well, no, let me say that differently. Schwann cells make myelin sheaths, but if a Schwann cell only makes myelin sheaths in the peripheral nervous system, oligodendrocytes are used to make myelin in the central nervous system. So the first thing you have to learn is the different types of cells and what their functions are. So this happens to be a typical neuron, but it is a neuron in the peripheral nervous system. We know that because they're showing you that a Schwann cell developed the myelin sheath. Okay? But at any rate, all neurons generally have dendrites. They have a cell body, or soma. They have axon, axon terminal, boutons, neurochemicals, so forth and so on. Okay. And we have two primary types of cells. We have neurons. Neurons receive all sensory motor activities and higher mental functions, and they're important for those cognitive behaviors we talked about, as well as speech and language, like attention, executive functioning, reasoning, calculation, problem solving, so forth. But then the second type of primary cell we have when we talk about nerve cells is the glia, or neuroglia cells. The neuroglia cells are important for support. They support and they protect the nerve cells. They're there to provide nutrition. They're there to assist in repairing and maintenance of the cell. They're there to engulf the debris that happens when there's damage to a nerve cell. So they also provide all metabolic functions to the neurons. So again, in the central nervous system, we have two types of cells. We have the neuron, which is important for higher order mental activity, and then we have glia and neuroglia cells, which are there for support. And some of the cells actually keep things out of the bloodstream that would be harmful to the neuron. So some of the neurons are important for the blood-brain barrier. They function to keep things that are bad out of the bloodstream. Some of the neurons are there to engulf materials or cells that are defective and that have died. Other types of cells are there for myelin, to develop the myelin in the central nervous system. And then, of course, you have cells that develop myelin in the peripheral nervous system. And then you have some cells that are important for lining the ventricles. And so we're going to talk about the different types of glia cells that are important to support the primary neuron. Okay? So these glia cells are astrocytes. Astrocytes are found in the blood's capillaries. They form the blood-brain barrier that restricts what substances can enter the brain. So, and this astrocyte also serves as they help to develop the structure of the neuron. So they're a basic building block. Microglia, this type of glia cell, remember all of these glia cells are there to support the neuron to make sure it's healthy or to get rid of things that are not healthy. And so microglia is important for removing cellular waste and protecting the neuron against microorganisms like bacteria, viruses, things like that. Oligodendrocytes are important for developing myelin in the central nervous system as opposed to the Schwann cells, which form the myelin sheets in the peripheral nervous system. And then you have the ependymal cells that form the lining of the ventricular surface. The ventricles are those spaces that I showed you in the textbook. And what is important about the ventricle is they have a structure in them called the choroid plexus that's important for developing cerebrospinal fluid. Cerebrospinal fluid runs through the ventricles, and of course the ependymal cells are important for lining the ventricles. Okay. Now, oligodendrocytes and Schwann cells indirectly assist in the conduction of impulses because they help with the speed or the velocity of the impulse that travels along the axon. If you didn't have myelin sheets, then the conduction or the speed of the impulse would be extremely, extremely slow. Okay? And when you have a problem with myelin, that's when we have multiple sclerosis. That happens because the myelin sheath degenerates, and so the speed of conduction is very slow, and so movement is very slow. Another problem with, and so if you have multiple sclerosis, it means that the myelin in the central nervous system has degenerated. It's breaking down, okay? If you have destruction of myelin in the peripheral nervous system, and of course the Schwann cells develop the myelin in the peripheral nervous system, then we have a syndrome called Guillain-Barré syndrome, and so that person has a problem with any kind of movement. In fact, they can't move most of the times. I mean, so we'll see some videos of that as well. Okay. So let's look at what these cells kind of look like. Because remember we said that the cells can vary in the function, the shapes, and the size. So here's an example of what an astrocyte looks like. and it's kind of like a star-shaped cell. If you can see, like it points out like a star. Okay. Well, actually, the microglia kind of looks like that too, but the microglia is important for engulfing like foreign or damaged material. The oligodendrocytes, the thing to know about them is not only do they produce myelin in the central nervous system, but they can produce myelin sheaths, more than one myelin sheath at a time on many different axons, as opposed to the Schwann cell. It's one Schwann cell for one myelin sheath. Okay? So here's an example of astrocytes again, and you can see these astrocytes. They look like little star-shaped kind of things. Again, they're important for protecting the blood-brain barrier, keeping foreign substances out of the blood. And they also provide nutrition to the neuron. They do a lot of things. So they're star glia cells. They also clean up debris within the brain, but not in the sense like the microglia. The microglia will actually move to the damaged area of the brain, and it will engulf, or like think of Pac. Did anybody think about Pac-Man? Well, maybe that's not a good comparison. But the microglia moves to that area of damage, and it just eats that debris. It just eats it. It destroys it. It engulfs it, and it destroys it. But if it leaves, like, let's say it leaves like a hole in that area or a space in that area, then the astrocytes will come into that area and form, they'll fill that space, or they'll form some kind of scarred tissue in that area. So it helps to clean up debris by engulfing that area and filling like the area after the microglia has like eaten or left something, like just, it's gone, but that area is just bare with nothing in it. Astrocytes also provide chemicals needed for proper neuronal functioning. They control the chemical composition of the fluids surrounding the neurons. So the neurons, remember, are in fluids. So the astrocyte controls, let's say the astrocyte aids in the nutrition of the neuron, if you want to think about it that way. So it provides nourishment to the neurons by receiving glucose from the capillaries. And remember that the neurons need glucose in order to survive. They break down the glucose to the chemical lactate, and then they release lactate into the extracellular fluid surrounding the neurons. So this is how they provide neurons. So when you help the neurons. So when you think about the astrocytes, I want you to think about three things. They're important they form the blood-brain barrier to keep foreign substances out of the neuron. If there is an area that needs to be cleaned up, they will actually form scarred tissue in that area or fill the void. And then they provide lactate or glucose to the fluid surrounding the neuron for nutritional purposes. Any questions about the astrocytes? So the 3 points for astrocytes. Number one, they form the blood-brain barrier to keep foreign substances out of, from the neuron and out of the blood. Okay? All right. The second thing is they help to clean up debris. So they can form scarred tissue if it's needed, or they can fill a void or a space that has been left there because the microglia has come in and engulfed or eaten up some damaged area of the brain. And then they provide nourishment to the neuron by taking glucose, breaking it down and turning it into a chemical lactate, and then making sure that that lactate is placed in the extracellular fluid that surrounds the neuron. So they feed the neuron, they protect the neuron, and they get rid of foreign materials. So this is what we mean by support. So remember, in the central nervous system, you have two types of cells. You've got the neuron, and then you've got neuroglia cells. The neuroglia cells are there for support, but there are different types of neuroglia cells. So the first one we're talking about is the astrocytes, and these are the star glia cells that do those things that we just talked about. Any questions about the astrocytes? Any questions? Okay, so I know it's going to be a lot for you to digest, so you can also look on page 156 of your textbook. And if you look at table 5.1, here is a description of the neuroglia cells and their functions. So we just finished talking about the astrocytes. And I'm telling you that astrocytes are located in the central nervous system in both the gray and the white matter. And of course, you can look at the functions. Again, they provide supporting network in the brain by forming a complete lining of external surface of the brain and blood vessels. So they do, like, for example, anything that you build has to have like a, how do I want to say it? It has a structure. So like when you're building a house, they put up the frame, so it has a frame. And then they build a house based on that frame. They put things within that frame, and they build around that frame and outside of that frame to develop the house. So the neuroglia cells kind of do the same thing in the sense that they help form the structure of the neuron, but they not only do that, they also form the blood-brain barrier. They keep foreign substances out of the blood that would be harmful to the neuron, because the neuron gets oxygen from the blood. It can't get, it doesn't make glycogen, but it needs oxygen and it needs glycogen. So the astrocytes make sure that nothing foreign gets into the bloodstream that could hurt the neuron. And then it also helps develop scar tissue for damaged areas of the brain. So it protects in that sense, and it helps to engulf and get rid of debris in that sense. And then it also provides nutrition by making sure that glycogen is turned into lactate, and lactate is supplied to the extracellular space, or extracellular fluid within the neuron. So very important, okay? All right, let's look at the next cell. This is neuroglia cell. It's called the microglia. And you can look at these brown areas here. These are microglia cells. Their primary function is to destroy, to get rid of or to engulf and destroy or eat things that are damaged areas of the neuron. So I call them kind of like the cleanup kind of cell. They clean up anything that doesn't need to be there. So they are the smallest of the glia cells. They act as phagocytes to clean up the debris in the central nervous system. So phagocytes mean that they kind of attach, that they travel to that area, they attach, and they just kind of eat it, or they break it down and they engulf it and they destroy it. They serve as representatives of the immune system in the brain, and they protect the brain from invading organisms, viruses, bacteria, things like that. Okay? All right. Oligodendrocytes. Here is an oligodendrocyte. But look at this oligodendrocyte. It is forming any kind of debris would be a virus or a bacteria, or let's say it's a part of a organelle that has been destroyed, or something like it could be a mitochondria. It could be that is no longer functioning. Okay? It could be a bad protein, yes, anything like that. All right? Because remember, these neurons are made up of proteins and glycogen. And of course, the neuron needs oxygen to survive too, so the oxygen and glycogen comes from the bloodstream. But sometimes viruses, bacteria, things invade the bloodstream, and so the job of the microglia is to get rid of any foreign substances that would cause harm, or that have already caused harm somewhat to the neuron. Okay. Any other questions? Okay, the oligodendrocyte. Remember now, the oligodendrocyte is important for making myelin sheets in the central nervous system. So the myelin sheets are formed around the axons. Okay, but look at this one oligodendrocyte, and it is forming myelin sheets around 1, 2, 3 axons, but this is only one oligodendrocyte. So it can form myelin sheets around multiple axons. But the Schwann cell cannot do that. It's one Schwann cell for one axon. Here in the central nervous system, the oligodendrocyte, you have one oligodendrocyte that's forming axons around forming myelin around 3 axons. So therein lies the difference there. And you can see this area is called the node of Ranvier. So what happens is after the oligodendrocyte forms the myelin sheets around these axons, the axons actually look like sausages. You know how sausages are? Like you get a link of sausages, and so there's that little break between sausage 1 and sausage 2. Well, that's considered in terms of the axon here, the node of Ranvier. And the myelin helps with the speed of conduction. I mean, the transmission of the impulse is very quick. But if you don't have myelin, transmission is very, very slow. Okay? So, let's look. So, the oligodendrocytes provide support to axons. They produce the myelin sheets, which are 80% lipid, 20% protein, which insulates the axons. The oligodendrocytes form segments of myelin sheets of numerous neurons at once. Allows for the efficient conduction of action potentials down the axon. In other words, allows for the transmission of the signal down the axon in a very fast manner. Okay? And we'll talk about how that happens tonight too. And of course, these are Schwann cells. So when we think of Schwann cells, then it's not the central nervous system that we're going to be thinking about. You need to think about the peripheral nervous system. Schwann cells develop myelin in the peripheral nervous system. However, these, you see how they are concentric or circular in nature? So it's one Schwann cell to one neuron. As opposed to a oligodendrocyte, one oligodendrocyte in the central nervous system can insulate or form myelin on many different neurons at the same time. Okay. So the Schwann cells are responsible for supporting the cells of the peripheral nervous system. They wrap themselves around nerve axons, but a single Schwann cell makes up a single segment of an axon's myelin sheath. The Schwann cells also aid in cleaning up debris in the peripheral nervous system, and they guide the regrowth of axons in the peripheral nervous system. Now, axons can regenerate in the peripheral nervous system, but they cannot regenerate in the central nervous system. So that's important for you to know. Now, in the central nervous system, axons can form new connections. And the way that is done is by you learning a new, I guess, task. If you continue to do the same tasks over and over again, then no new connections are established. So, for example, my mother plays bridge 3 times a week, but there's something that she's done and she's learned and she's very good at it. So she's not developing new neural connections by just playing bridge, but if she took up a new hobby, then the brain would grow. Those connections would expand. And so the way you develop and you stay healthy and you keep your brain active is to constantly learn to do something new. Okay. Now, in the peripheral nervous system, if there is damage to an axon, the axon can regenerate. Okay, but again, that's in the peripheral nervous system. It is not in the central nervous system. Okay? So, any questions thus far? So, Schwann cells, they arrange themselves in a series of cylinders that serve as a guide for sprouts of regenerating axons. Sprouts will grow through the cylinder at the rate of 3 to 4 millimeters per day, and non-productive sprouts will wither away. Okay, so here's an example of nerve cells growing through this cylindrical Schwann cell formation in order to aid in regeneration. And one thing I want you to know is that the important difference between the central nervous system and the peripheral nervous system in terms of cells is that, of course, you have the different myelin-forming cells. So Schwann cells produce myelin in the peripheral nervous system, and oligodendrocytes produce myelin in the central nervous system. But you also have the presence in the peripheral nervous system of endoneurium. It's a fibrous connective tissue that covers the axons. And you don't find that in the central nervous system. The Schwann cells kind of myelinate in a jelly roll kind of fashion. You've got one Schwann cell to one neuron exclusively. But again, the oligodendrocytes myelinate many axons in the central nervous system at the same time. So the composition of the central nervous system and the peripheral nervous system in terms of nerve fibers actually differs. Okay? Any questions about anything that I've talked about? And I'll show you a video of this. The ependymal cells are important because they line the ventricles, and the ventricles are where cerebral spinal fluid can be found. And cerebral spinal fluid acts as a cushion for the brain. We have, again, a structure in the ventricles called the choroid plexus where the cerebral spinal fluid is produced, but the ependymal cells actually line the ventricles. Okay, so this is an example, another example of ependymal cells. You see they have cilia, like these hair-like structures that kind of come out off of as part of the lining. I guess that's the best way to say it. Okay, so that being said, before we talk about the different types of cells, we've talked about the fact that we have two types of cells in the central nervous system. We have the neurons, which are, important for your everyday functioning, thinking, talking, reasoning, so forth and so on. But we have neuroglia cells that support the actual neuron by protecting it, getting rid of foreign and damaged, I guess, what do I want to say, damaged components, making sure it has the right nutrition that it needs, like lactate, which has glycogen, so forth and so on. And then we also have, speed of conduction as an issue. So when you feel some type of sensation, you want to really feel it and be able to react to it in a very quick manner. So we have different types of cells that produce myelin sheath in the CNS and the PNS. And of course, so now what I want to show you is a little video called Neuroscience Basics, Neuroglia Functions. And this is like an animation to kind of bring home my point. Then we'll come back and talk about the different types of cells. But any questions while I'm pulling up this video? Does anybody have any questions about what we've talked about, what a neuron is, what neuroglia are? Okay, so let's see if I can pull up this video right quick. Okay, so the name of this video is Neuroscience Basics. I'm trying to type it while Neuroglia Function Animation. Okay. All right, so here it is. Now, I'm going to go ahead and do the web address for you. Oh, wait a minute. Okay. Oh, wait a minute. I need to play it, but let me copy, cut and paste this. Okay, so can you guys see this? Can you see it? Okay.
They wander through the brain tissue, phagocytizing dead, injured cells, and foreign invaders. High concentrations of microglia are an indication of infection, trauma, or stroke. Astrocytes are the most abundant and functionally diverse glia. These star-shaped glial cells provide supportive frameworks to hold neurons in place. They provide neurons with nutrients such as lactate. They also produce growth factors that promote neuron growth and synapse formation. It's been suggested that astrocytes can control how a neuron is built by directing where to make synapses or dendrites. Through their processes, known as perivascular feed, astrocytes induce endothelial cells of blood vessels to form tight junctions. These tight junctions are the basis of the blood-brain barrier that restricts the passage of certain substances from the bloodstream to the brain tissue. Astrocytes help to maintain the chemical composition of the extracellular fluid. They express membrane transporters for several neurotransmitters such as glutamate, ATP, and GABA, and help to remove them from synaptic spaces. Astrocytes also absorb potassium ions released by neurons and synapses. This helps to regulate potassium concentrations in the extracellular space. Abnormal accumulation of extracellular potassium is known to cause epileptic neuronal activity. Recently, it has been shown that astrocytes can also communicate electrically with neurons and modify the signals they send and receive. In a manner similar to neurons, astrocytes can release transmitters called gliotransmitters upon stimulation. This suggests that astrocytes may be involved directly in the communication functions of the brain. From the clinical viewpoint, neurons have little capacity for renewal and therefore rarely form tumors. On the contrary, glial cells are capable of dividing throughout life and are the primary source of brain tumors. Thank you for watching. Please feel free to suggest a topic you want us to cover by leaving a comment below.
Okay, guys, so the video's kind of helping you a little bit because what you have is I'm trying to give you a resource to go to kind of help reinforce learning the material. But, you know, I know that we have a very long class and there's a lot to learn, but I actually need the time because there's so much that I have to teach you. So how are you doing? How are you doing kind of understanding the material? Because I want to make sure that I'm not just giving you a lot of material and that I know it's a lot. Okay. Okay. Yeah, we'll do lots of videos on the brain. But what I want to make sure, I have to use the class time, and I know it's so much. I know that, you know, you're listening to me in the attention span. I mean, I know it has to be hard listening to me talk a lot, but I don't know how else to get through the explanation of it. So if you have suggestions that would help me to help you get it, okay, I'd like that, Rachel. Let's see if you could send us the link for when we study. That would be helpful. Why don't I just put, one thing I could do is put the links in, just like do in the content section, just like a link to go with each lesson, so you can actually kind of watch the videos. Because I find that, like, by watching them myself, it's so easy. I was like, oh, yeah, I got that, because, you know, now I can see it. But it's just so, like, much. So I feel like sorry for you guys on the other end sometimes, because for me this stuff is coming so naturally. But for you, it's all new material, and that's why I'm trying to be sensitive to what I'm pushing at you. Okay, that would be good, too. So what I'll do is try to build, I'll try to build like I said, I'm going to put Cahoots in next week, but I'm going to try to build like segments in the class where we can learn and then we can do some activity, so it'll help you too, because I'm just realizing now I've had a long day, so I'm tired. But the point is the information is second nature to me. So I'll try to interact a little bit more with you. And what I'd like to do is just go through, maybe, if you'll let me get through a little bit more slides, because chapter 2 takes a long time. Then hopefully, you know, I'll make it more interactive for you. So first thing you got to learn is, what is a neuron? I'm telling you that. And what does it do? And it, you know, it reacts to stimuli. So, and it's important for us to be able to function. I mean, to move, to touch, everything. Our body is made up of protein, in neurons. And then the second thing you got to learn is, what are the types of cells in the central nervous system? We already said there are two. There's the neuron, which helps us to live, and then there's the support. And the support helps the neuron to survive, and that's the microglia. And then you got 5 different types of those. But we also have different types of neurons. We have the multipolar, and the multipolar is a motor neuron. It's important for us to be able to move. So multipolar has many dendrites and a single long extension called the axon. This is found in the central nervous system. Bipolar, you only have one dendrite and you have an axon, but these are the types of cells that we find in the eye, the inner ear, in the olfactory, or the nose. And then we have the unipolar. And unipolar are sensory neurons. They only have like one extension. They actually look like a T. So they have a single extension that functions both as the axon and the dendrite. So the picture of that is here. So you can see here on this multipolar, you've got, look at all these extensions. All of these are dendrites. Look, many dendrites coming off of this one cell body here. And then, of course, here's your axon. That's a motor. These are multipolar are motor neurons. So they are responsible for us in movement. And you can see the same thing kind of here. Okay? All right. Now here, in this is a bipolar, you've got one extension here of a dendrite. Here you've got multiple extensions. When we talk about multipolar, you've got multiple extensions with these tree-like things. That's one. That's two right there with the tree-like branching out. So here is one extension. This is one dendrite with these trees. Then you've got the cell body, and then you've got one axon. So this is a bipolar. This is what, again, we find in the retina, we find in the nose, we find in the ear. But this monopolar or unipolar, here's your soma cell body, and here you've got an extension coming off that. And on one end is the dendrite, on the other end is the axon. Okay, and that's important because it is a sensory neuron. Okay, and all sensory neurons look like that. Okay. Yes, that is correct. They all have one axon. But how the axon comes off of the cell body is what you're looking at. Okay? So multipolar, many dendrite extensions, one axon from the cell body. Motor. That's motor. Okay? So if you have damage to multipolar neurons, you're not going to be able to move. If you have damage to bipolar neurons, then you're going to have problems with vision, hearing, depending on where the neuron is. And then if it's sensory, you're going to have problems feeling. Okay? And so here's another example. Multipolar neurons have many dendrites and one axon. They're found in motor neurons and interneurons. Interneurons are like in the spinal cord where the sensory information comes into the dorsal part of the spinal cord, but it's reflexive in nature because it's something like I put my hand on something hot. So it goes from that dorsal area to that interneuron, which I have to show you the anatomy of the spinal cord. And then it goes out to the efferent area, or the motor area, back out to the muscle, and you move. So that's what we mean by interneuron. There's the bipolar again in the eyes, the ears, and the nose. And then look at this unipolar. There's the cell body, and you can see the extension from the cell body. So for me, it's kind of like a T. Okay, these are sensory neurons, and they're found in the spinal cord as well. Okay. All right, let's see. Sensory neurons transmit information from receptors to the central nervous system. Motor neurons relay messages from the CNS, or the central nervous system, to muscles and glands. And then, of course, interneurons link sensory and motor neurons to one another. So think about if it's interneurons, then we're almost talking about, we got to be talking about a reflexive type of behavior that has occurred. I stepped on a sharp object, I moved my feet quickly, I put my hands on something that's very painful, I move it, so forth and so on. Okay. Any questions about those three different types of neurons? Or cells, multi, bipolar, or unipolar? Okay, hearing none. We've already talked about the axon in their cell bodies, but one thing I want to point out, the axon, remember, has a dendrite, has a soma or a cell body. It also has axons and the terminal boutons, so forth. But one thing I want to point out is that the nerve cell is synonymous to neuron. If somebody's talking about a nerve cell, they're talking about a neuron. The other thing I want to point out is that the cell body or soma is not equivalent to the neuron. It is a component of the neuron. And this is a point I wanted to make too. There should be but if the cell body of a motor neuron of the spinal cord were enlarged to the size of a baseball, the axon would be about 1 mile long, and the dendrites and their branches would arborize throughout a large amphitheater. So you can have, like, axons can extend from the central nervous system through the brainstem all the way down to the bottom of your feet. I mean, they could be very long. So, you know, I want you to get into your mind that there's a difference in size and shapes of these neurons, okay? And so here's a typical neuron that we're looking at again, and this is a myelin. You can see the myelin sheath. Now, again, if these myelin sheaths are in the central nervous system, if this is a central nervous system neuron, then that means that the myelin sheath was developed by the oligodendrocytes. If it's in the peripheral nervous system, it was developed by the Schwann cells. Okay, so just pointing that out because, you know, that's something that I ask. So we already looked at neurons and how they work. So I want to show you, I want to talk about now the cell body, and I'm going to show you another video of the cell bodies and the organelles, because each neuron contains a large nucleus and it has a number of organelles, including the Nissl bodies, endoplasmic reticulum, mitochondria, Golgi apparatus, lysosomes, plasma cell membrane, and then these neurofilaments and microtubules. Now, the thing about this is all these things have a function, and the basic function is to either to make protein or to transport protein throughout the cytoplasma, or you know, to outside of it, to other neurons or whatever. And things such as the mitochondria, well, that's important that's the energy source of the neuron. So it supplies ATP, which gives the cell glycogen, because, you know, normally it's not in the bloodstream, okay? The Golgi apparatus, I want you to think of as a post office, or no, not as UPS. They're going to sort and they're going to package things and send them somewhere. Okay, and then the lysosomes I want you to think of as engulfing any virus or bacteria or cancer cells or whatever, anything. Now we said that microglia do the kind of like the same thing. Well, lysosomes do that, form that function. Okay, so let's look at the function of some of these things, and then look at a video, and then I'll end class tonight, because it's a lot. And so I need you to have some time to digest this information. So here's a typical neuron. And now this is the part we're going to be learning about tonight. All of these organelles, okay? So you can see here Golgi apparatus. It's kind of hard because this is Golgi apparatus. Here is the nucleus. The nucleus contains DNA, and DNA is what we need to make life. I mean, everything needs DNA. Then here is the RNA, and RNA creates the ribosomes that we're going to talk about. But RNA is a messenger carrier. So it carries information from the DNA out of the nucleus into the cell body. And what happens is DNA cannot leave its area, but RNA can send out messages. So it's a message carrier. Okay, remember mitochondria is the power source. It supplies the cell with ATP. Remember lysosomes engulf foreign material like bacteria, viruses, so forth and so on. Reticular formation. The reticular formation has ribosomes on it, and ribosomes produce proteins. They synthesize protein, but the reticular formation serves as a highway. So it helps to carry the information from RNA through those ribosomes out into the cell, into the cytoplasm. Okay? So that being said, the nucleus is located in the cell body. It contains DNA. In the nucleus, we also have a prominent nucleolus, which is composed of RNA, ribonucleic acid, which is associated with the synthesis of proteins. Within the nucleus, we have the sex chromatin bodies. So, you know, DNA is important for genetics and creating females versus males. Okay. What else do I want to tell you? DNA is very stable. It has error detection. It stays in the cell's nucleus. It can make copies of itself. It can never leave the cell's nucleus, as opposed to RNA, which is single-stranded. It's a messenger. It carries single pages of instructions out of the nucleus to places where they're needed in the cell. It cannot repair itself. It does not make copies of itself, and it evolves 10 times faster than DNA. Okay? And so here's an example, again, of the organelles that we will find within the soma, or the cell body. You've got your mitochondria. Here's your nucleus, which has DNA. DNA cannot leave the nucleus. You have RNA in the nucleolus. RNA is a carrier, a messenger carrier. And here we have endoplasmic reticulum, which has either rough or smooth. It can be rough or it can be smooth. If it's rough, it has ribosomes on it. The Golgi apparatus packages and sorts proteins and sends them wherever they need to go. Lysosomes are created out of the Golgi apparatus, and they're there to engulf things that don't need to be in the cell body. So that gives you an example of that. So Nissl bodies are the protein synthesizing machinery of the neuron. They are composed of ribosomes, endoplasmic reticulum with ribosomes, free ribosomes. Those ribosomes just kind of float freely in the plasma membrane area, and then ribosomes and Rossetti. Ribosomes manufacture receptors, vesicles, membranes, tubulars, in order to transport proteins. So the big thing you need to know is that ribosomes are important for synthesizing proteins, and endoplasmic reticulum act as the highway to send those proteins out. So that's what Nissl bodies look like. What I'm going to do to kind of help you understand this is what a ribosome looks like. And they make different types of proteins, so you don't have to learn the different types of proteins, but proteins make up the cell and organ structure throughout the body. The endoplasmic reticulum acts as the highway, okay, to carry ribosomes. So these are the different protein structures. Don't worry about learning them. Just know that the cell body is important for, and the structures in there are important for synthesizing proteins and sending them where they need to go, or either making sure that, ribosomes. Endoplasmic reticulum act as the highway, but they carry ribosomes from the RNA. Okay, so what I'm going to do, instead of going through this part right here, let me show you right quick. Let me show you the last video. Let me show you the last video that will help explain this, and then you take some time and go back through the PowerPoint and just look at the functions, and then the next time what we'll go through is nerve conduction. Okay? So let me do this right quick. Okay. So give me 1 minute. I'm trying to put the URL up, but because this will help you. And after we look at this, we'll call it a night. So the name of this is going to be organelles of the cell, and their functions. Okay. All right, so here it is. Wait a minute. Wait a minute. Okay, wait a minute. No, wait a minute. This is not the one I want to show. Let me try it one more time, guys. Okay. Here it is. Can you guys see this? If you can see it, tell me yes.
cells are feed on and those that produce beautiful proteins. In addition to providing a surface area for liposomes, that PR serves as a storage area for newly synthesized molecules. Another type called screen has no ribosomes. Water gems. And that includes like replica, serves endoplasmic reticulum serves as a storage area, mainly for proteins that the later transported out of the cell. Ribosomes are the most detailed structures in the cell. They stand on a left attached to the right endoplasmic reticulum. Ribosomes, which are composed of RNA and protein, are the primary site of proteins in the cell. So rather than saying understand why ribosomes are still ribosomes. The location of ribosomes within a cell provides an indication as to their specific function. Those located on the left endoplasmic reticulum synthesize proteins that will eventually be used in the cell's plasma membrane or exported out of the cell. Ribosomes that locate in the cytoplasm synthesize proteins. Proteins and lipids throughout the cell. The proteins and lipids inside the cell used in the plasma membrane will be exported outside the cell. Thus, cells that produce high quantities of proteins and lipids need extensive Golgi apparatus. Exosomes are membrane-enclosed vesicles that form the Golgi apparatus. They may contain over 40 different powerful enzymes that are used to digest and destroy large molecules. Lysosomes, like white blood cells, destroy foreign substances, such as viruses and bacteria that invade the body. Lysosomes also recycle older or damaged organelles. By injecting selected organelles and digesting them with powerful lysosomes are membrane-bound vesicles that contain hydrolytic enzymes. The hydrolytic enzymes break proteins, nucleic acids, lipids, and carbohydrates, and are formed in the endoplasmic reticulum. These enzymes are then transported to the Golgi apparatus by transport vesicles. The lysosomes rise from the Golgi apparatus. When particles such as viruses or bacteria are ingested by phagocytosis, the lysosome uses the particle-containing vesicle called a phagosome and delivers the hydrolytic enzymes. Lysosomes also fuse with organelles such as whole mitochondria. This results in the destruction and recycling of these structures. You may have heard the mitochondria of protein as the powerhouse of the cell. This important organelle generates energy in the form of ATP to keep the cell alive. Some cells may have one large mitochondria. More often, however, cells contain hundreds or even thousands of mitochondria. Cells that require more energy, for example, liver and muscle cells, have many more mitochondria than cells that require less energy. Structurally, mitochondria vary in size and shape. However, all mitochondria have two membranes, an outer membrane, the membrane, which is arranged in a series of internal folds called crispin. The many folds of crispin provide an enormous surface area where phytochemical reactions occur. This chemical activity in turn provides energy for the cells. The mitochondria are cellular kinase, that is, they can grow and self-replicate within the cell. Each mitochondria contains its own ribosomes and a small amount of DNA. Interestingly, mitochondria resemble bacteria in size and biochemistry. And some scientists believe that the eukaryotic mitochondria were evolved from ancient bacteria.
Okay, guys, so that gave an overview of what those organelles do in the cell body or in the soma. Anybody have any questions? Any questions? Okay, well, you guys have been troopers. You hung in there tonight. What I'll ask you to do is review the PowerPoint, read Chapter 5, and I'll send you the links that we watched tonight so you can watch them again. And I will see you next Wednesday then, okay? All right, guys, good night, and thank you.